Medical Officer at the New York City Department of Health and Mental Hygiene. I'm joined today by my colleagues Gretchen Van Wee, Assistant Commissioner in the Bureau of Vital Statistics, Carolyn Olson, Assistant Commissioner in the Bureau of Environmental Surveillance and Policy, and Elizabeth Solomon, Executive Director, Nutrition Policy and Program. Thank you all for the opportunity to testify today on Healthy NYC, our campaign for healthier, longer lives. In November 2023, we launched Healthy NYC, not as a singular Health Department initiative, but as an overarching framework for how New York City should approach public health. Every piece of our work at the Health Department and work beyond this agency is in pursuit of citywide emergency response proved that public health works when there are significant investments and a whole of government response, and Healthy NYC builds on that success. This is public health at work. We've set out to raise the life expectancy of our city to its highest ever level, 83 years by 2030. To achieve that overarching goal, Healthy NYC sets ambitious targets to address the greatest drivers of premature death, including chronic and diet-related diseases, screenable cancers, overdose, suicide, maternal mortality, violence, and COVID-19. As acting health commissioner and as a practicing physician at Health and Hospitals Kings County, I have seen firsthand how these drivers impact New Yorkers. They degrade our health and shorten our lifespans. We're excited to discuss our activities over the last year with you, including the release of our latest data sets, which we announced at our recent Healthy NYC Symposium. I also want to express my gratitude to Speaker Adams, Chair Shulman, and all the members of the City Council who voted to make Healthy NYC a local law. From its inception, Healthy NYC was designed to be an evolving project. By codifying this work, you all helped to ensure that we continue to reevaluate our goals and approaches in accordance with the latest data. You also helped preserve Healthy NYC as a permanent part of the architecture of this city, regardless of changes in administrations and commissioners alike. We appreciate your commitment to this endeavor, and we thank you for working with us to accomplish this goal. By adopting a goal of raising our city's life expectancy, we have committed ourselves to improving a critical measure of society's progress. We're part of a field that has dramatically remade human history. Public health has proven its value time and time again through improvements in sanitation, water infrastructure, vaccinations, and more. And we've been able to extend life expectancy in our city and our country by several decades over the course of history. It's now time to take another leap forward. We're coming off the heels of a pandemic that took years off of our lives. In New York City in particular, life expectancy dropped by nearly 5 years in 2020. We need to recover the years lost and extend life expectancy, which had stagnated for nearly a decade before the pandemic. The New York City Health Department is the oldest and largest health department in the country. We have a staff of over 7,000 people, and we possess both deep public health expertise and a clear commitment to racial equity. The latter has been notably absent from major public health advancements over the course of our history. For instance, reliable access to clean drinking water helped dramatically increase national life expectancy, but access to that water was not and is still not shared equitably. Most places you look in education, housing, and beyond, outcomes across our society are stratified by race and by wealth. This time, as we set out to improve life expectancy, we've resolved to interrupt a long historical pattern of indifference towards racial inequities and unfair access to life-saving treatments. To that end, we have structured our work around 3 distinct pillars. The first is our public campaign, which aims to educate New Yorkers about our work and the resources available to them. The second is our commitment to bring together experts and stakeholders from often siloed sectors, be that public and private, community and government, or public health and clinical care. The last pillar is our recognition that none of this work matters unless we change the way we focus our resources. We're working to ensure that public health interventions with proven success continue to make an impact. The foundation that unifies all 3 of these pillars is equity. We're determined to create and implement targeted health interventions that address the centuries of disinvestment responsible for inequitable health outcomes. In our first year, we have made remarkable progress. we launched our Healthy NYC Partner Program to bring in a diverse set of stakeholders from clinical care, academia, and the private sector. Healthy NYC partners formally join our cause for healthier, longer lives. They help publicize our campaign, contribute to one or more of the goals in the work, and lend their resources to these efforts. We also developed 7 strategy maps to align with each of our health equity New York City goals. Our strategy maps identify the most effective health interventions for each mortality driver and name the stakeholders, including healthcare systems, policymakers, and community-based organizations that are best positioned to carry out those interventions. They serve as a guide both for the health department and our broader network of partners as we continue to work towards our goals. The strategy maps complement topic-specific plans and reports that the health department has issued in recent years that outline strategies and recommendations. These reports include Care Community Action, a mental health plan for New York City released in 2023, the Maternal Mortality Review Committee's report on pregnancy-associated mortality in New York for the years 2016 to 2020, which was released in September of this year, and a forthcoming report on chronic disease that we plan to issue in early 2025. Lastly, we've announced our partnership with the Institute for Healthcare Improvement to launch 3 improvement collaboratives over the next 2 years. These improvement collaboratives will focus on behavioral health, preventive health, and maternal mortality. Each one will bring together relevant stakeholders to create and implement a path forward for better health outcomes in their area of focus. While we're currently planning in the planning stages of this work, the collaboratives will launch in the spring of 2025. As we continue to refine our work and launch new programs, we need a clear picture of health in New York City in as close to real time as possible. That leads me to the reason we're here today, the release of our 2022 data. I'd like to preface this by clarifying that this is our most recent set of numbers from 2022, and we launched Healthy NYC in November of 2023. We can't attribute these numbers, for better or worse, to this campaign just yet, but they do offer a clearer picture of the state of our city. They provide us with crucial guidance and insight on how we might refine our focus moving forward. There are a few trends I'd like to highlight today. The first is our overall progress toward higher life expectancy. We're on track to meet or exceed our goal of raising New Yorkers' life expectancy to at least 83 years by 2030. Life expectancy at birth in 2022 rose to 81.5 years. That's up by almost a year from 80.7 in 2021, but it's still about 1 year below the pre-pandemic level in 2019. As a city, we're moving in the right direction, but even as we gain back some of the time we lost in the pandemic, we've maintained the pre-existing inequities in lifespan. Black communities die younger than their white, Hispanic, and Asian neighbors. These data reveal that despite citywide gains, Black New Yorkers are dying more than 5 years earlier than white New Yorkers. I also want to acknowledge that New York City is home to the largest urban population of people identifying as natives, First Nations, and indigenous peoples of the Americas in the United States. That group constitutes about 118,000 people, which is 1.3% of our city's population. They are not reflected in Healthy NYC due to the size of the population and smaller numbers of deaths, which makes 1 year's statistical estimates unreliable. Now I'd like to parse out what's driving both the increase in life expectancy and the persistence of racial inequity. Let's start with the good news. We're gaining back years largely because COVID-related mortality has dropped so dramatically in recent years. From 2021 to 2022, we saw a 48% decrease in COVID-19 deaths, the rate of COVID-19 deaths. We're well on our way to surpass our goal of a 60% decrease by 2030. That drop is in and itself an enormous victory. But what stands out to me is that overall numbers have declined and the gaps between racial groups have narrowed significantly. At the height of the pandemic, there was massive racial inequity in COVID-19 related deaths. In 2020, Black and Hispanic New Yorkers were dying at twice the rate of white New Yorkers. In 2022, COVID-19 mortality was 1.2 times higher among Black residents than their white and Hispanic counterparts. While these health outcomes are still not equitable, it is a meaningful improvement. Racial inequity in COVID-19 deaths is now significantly less than it is among our other major mortality drivers. COVID-19 is our proof point that we can make meaningful and rapid change when we have the political will to take a cross-sector approach to public health and can invest in the resources needed in priority communities, all a part of operationalizing equity. There are other areas, however, that are slower to progress. We did not see a statistically significant change citywide or in terms of racial inequities in death rates for heart and diabetes-related disease, which remain the leading cause of death in our city. We'll continue to monitor these numbers closely and prioritize our health interventions in that arena. Our 2022 data also revealed some areas where death rates are climbing. Overdose deaths more than doubled from 2019 to 2022, and that uptick has been especially steep for Black and Hispanic New Yorkers. To me, what puts the gravity of this trend into perspective is just how much overdoses have climbed the ranks. In the last decade or so, they have become a leading cause of death in New York City. In 2010, overdoses were the 10th leading cause of death in New York. In 2020, they were 6th, and in 2022, they ranked 4th. We're facing a crisis that has dramatically worsened in recent years, especially among Black and Hispanic communities. The increased isolation imposed by the pandemic and the influx of often undetected fentanyl in the drug supply have had devastating effects across our city. More than 80% of fatal overdoses involve fentanyl in 2022. The racial inequities in these deaths are a clear consequence of long-term community disinvestment and structural racism. While our overdose prevention efforts are citywide, they focus on communities with the highest need. We're working to make naloxone and fentanyl test strips widely available, to strengthen our harm reduction programs, and to partner with community-based organizations in high-need areas to support the full continuum of care. Perhaps the most important thing these data can show us are the pain points of our city's health. The numbers illuminate the issues and communities we owe our care, our attention, and our resources. It's up to us to listen and to act. So as we enter the second year of Healthy NYC, our charge is clear. While we work to give all New Yorkers more time, we can't lose sight of the reality that we're facing, deep inequities in longevity. Who lives and who dies? There's no more valuable currency than time, and in turn, there's no greater injustice. Healthy NYC is working just as it was intended to. The data we're collecting offers insight for how we can better tailor our work to the needs of the city we all serve. I'm proud of this work, particularly the gains in life expectancy we made as a result of our whole of government response to the COVID pandemic, and I believe wholeheartedly in our potential. We owe it to New York and to Black New Yorkers in particular to do everything we can do to give them more time with the people they love. We look forward to working with Council as we continue this work, and we thank you for your ongoing partnership. I'll now turn to the legislation that's related to the hearing today. First, I'll address Intro 641, which relates to nutritional standards and beverage options for children's meals served in food establishments. The Health Department consistently supports efforts to promote healthy eating, and we appreciate the intent of this bill. As this bill is currently written, restaurants would not be able to comply with the terms of the legislation, and the Health Department would be unable to enforce it, but we look forward to continuing the conversation with Council on this legislation. I would also like to address Intro 1047, which relates to establishing a sleep apnea screening pilot program and public health and education outreach campaign. The Health Department does not provide care that requires specialized repeat visits to clinical healthcare facilities and therefore is unable to stand up this type of programming, but our colleagues at Health and Hospitals have submitted written testimony on their sleep apnea program. Thank you again for the opportunity to testify today, and I'm happy to answer any questions.
Thank you for the comprehensive testimony, Dr. Morse. So it has been a little over a year since the administration announced the Healthy NYC campaign to increase life expectancy for New Yorkers. What challenges have you faced in implementing programs or initiatives that are part of the campaign? And how do you plan to address those?
Thank you for that question, Council Member and Chair. It has been a very powerful learning experience over the past year as we both are even more transparent with data and trends, and as we hone in even more on the 7 main drivers of lowered life expectancy in New York City. So far, there are challenges, but we also have a long history of working on exactly these 7 drivers in the New York City Health Department. We have over 7,000 staff, And much of their work is related to those 7 main drivers of shortening life expectancy, areas that shorten life expectancy. So although we are still learning, I do feel like we're on the right track, and we've learned already how to engage stakeholders, both our sister agencies across government and those external to government, in really rallying around this campaign. I would say that the areas that we need to continue to focus on are what I mentioned. It's very, very powerful to see a near elimination of racial inequities in COVID-19 related deaths with our multi-year whole of government response. And that is a model that we can use to address other areas of concern, like the increase in overdose deaths. So we do have our work cut out for us, but I expect that with our track record in public health of really extending life expectancy in leaps over many decades, that we'll be able to get on track.
So you also mentioned in your testimony the 2 areas that are somewhat challenging, cardiovascular health as well as diabetes. Do you have anything in particular that you'd like to maybe do differently and maybe think out of the box a little bit, because it's always been an issue?
This is true, Chair. This is a big challenge. And cardiometabolic disease, cardiac and diabetes-related disease has been the #1 cause of death for many, many years outside of the COVID pandemic. So we are familiar with the challenges of addressing chronic disease, and we have more work to do. We're very excited to, in early 2025, be releasing a chronic disease report that focuses on 3 main areas of work. The first is material needs. That's what does someone need to be able to live a healthy life, whether that's housing, transportation, support for buying healthy and nutritious food, those kinds of things. The second area is commercial determinants of health. These are what are the practices of corporations that either facilitate or undermine healthy choices, and that includes areas like alcohol and tobacco and other areas. The third area of focus in our chronic disease report is on healthy living and healthy behaviors. So things like our active design guidelines are one of the areas that's described in the report. So we do have what we think is a really powerful report that's going to set a powerful course forward for some of the work city government can do in preventing and addressing chronic diseases. And as a practicing clinician, I will also say that diabetes and cardiac disease is one of the biggest challenges we face. When I work at Kings County, I see the complications of those chronic diseases in particular every day, and there is more work to do. And then the final thing I'll mention is that we do have a database that allows us to monitor diabetes, both the prevalence of diabetes as well as uncontrolled diabetes across the city. Every year we submit a report to council on that diabetes prevalence, and we look at it by population, we look at it by neighborhood, we look at it by income level. What we have found year after year is that there is a large inequity in the prevalence of diabetes. So for example, there's almost a 2 times higher prevalence of diabetes in some areas of the South Bronx as compared to Greenwich Village and Soho. So we know that we need to focus on the neighborhoods where diabetes is a major challenge. We also know that we need to focus on New Yorkers who are living with low wealth. The gap in diabetes prevalence for the highest wealth neighborhoods as compared to the lowest wealth neighborhoods is significant. So those are the kinds of data that help guide the health department in deciding where to implement programs, where to focus our resources, and how to engage with New Yorkers experiencing complications from diabetes.
Yeah, offline, I want to have a conversation with you because we're getting into budget season about what maybe we can do beyond the normal course of business. The other is that I just wanted to ask you, and this is just out of the box, so I don't know if you're aware, NIH is doing this massive study right now about individual health diets for individuals based on their metabolism, and they have it was on one of the news shows, either CBS This Morning or something like that, where they have people who have volunteered and they live on campus where they're doing this, and they have them eat certain meals, and it's geared towards their exact makeup, their genetic makeup, their all kinds of things. So it's an individual diet for folks, and it's a massive study. I don't know, I mean, the administration's coming to an end. I don't know if they're going to continue it or not, but maybe it's something to take a look at.
Well, Chair Shulman, we would number one, love to continue the conversation about what we can do to better address diabetes offline, and we will look into this study. I'll also say that in addition to that study, which I'm sure will be very informative, we also know that things like guaranteed basic income for New Yorkers who are experiencing diabetes and complications, as well as other innovative approaches to address material needs, access to healthy and nutritious foods, all of those kinds of things would make a big difference. So we look forward to that conversation.
And I also think that if we can make it easier for people to take care of themselves, I think that would be helpful too, which feeds into a lot of what you discussed. How are you working with H&H on all of these things?
Thank you for that question. And we completely agree with you that part of the goal in Healthy NYC and our focus on chronic diseases is to make the healthiest choices the default and easy and accessible choice for New Yorkers. One of the really important ways that we do that in the New York City Health Department, and that is directly in partnership with Health and Hospitals, is we do have very extensive programs helping to enroll New Yorkers in health insurance. And part of the reason that that is important is because having all of your preventative care, your screenings for cancer and otherwise, all of those kinds of things are even more accessible and easier to access with health insurance. So we do continue to partner with lots of stakeholders across the city for enrollment for all New Yorkers who are eligible in health insurance. And we also work with Health and Hospitals on NYC Cares, which is their healthcare access program for people who don't qualify for other health insurance forms. We specifically also work with them on a program called Groceries to Go, which really also tries to ensure that New Yorkers who are food insecure or nutrition insecure have an easier way to access the food and healthy food as well that they need.
I believe that's fully funded now, as a matter of fact.
For this year, it is.
For this year, yes. So the other thing that I just also want to mention is I'd like to see at some point a collaboration of H&H, DOHMH, and maybe some of the pharmaceutical companies, because they have a lot of things in the works in terms of groundbreaking treatment for, so as an example, I have high blood pressure and I don't do well on the medications, but there's a drug in stage 2 testing that it's an injection that you would get once every 6 months, and it's had good results so far. I mean, it's another 2 or 3 years before it's on the market. But if there's a way for us to get folks into some of those maybe clinical trials, or see if there's a way once something is out on the market and FDA approved that we have access to it. So I just want to make that suggestion, because that's much better than taking a pill that has side effects and everything else.
We are happy to work with Health and Hospitals on access to drugs that address hypertension. We also know that the prevalence of hypertension for adult New Yorkers is upwards of 30 to 40%, depending on the population you look at. And so we know that high blood pressure is a major issue we need to continue to address. It's part of Healthy NYC, and we have a program called Take the Pressure Off that's really geared towards specifically doing that, increasing access to blood pressure cuffs, to treatment, and also, I would also mention, of course, the health department's track record in salt labels and labeling food that has a high content of salt, which we know also is a contributor to lots of chronic diseases, including hypertension.
Thank you. I'm just thinking out of the box and into the next century. The council received the first annual progress report on Healthy NYC last week, which is required by my bill, Local Law 46. The report submitted only includes data through 2022, a year before the program's launch. You mentioned this in your testimony, but recognizing that this data provides a limited baseline, when will DOHMH have access to more comprehensive data prior to the publication of the annual report due next September?
Thank you for that, Member Chair. Question, Chair Shulman. We are doing a lot of work internally in the health department to have access to even more timely data. We do think Healthy NYC is a motivating and mobilizing framework that allows us to have even more timely data and be even more transparent about that data. We are working already on really getting things ready for our annual report, And I would also just note that even though 2022 data feels perhaps maybe not quite as timely, it really is giving us a sense of the trends, and we are happy to see the trends towards increasing life expectancy in 2022. I may just ask my colleague, Assistant Commissioner Gretchen Van Wee, to also weigh in on this specific question.
Hi.
Hi.
Yes, as the commissioner mentioned, we are doing everything we can to prepare the data and have it released in a more timely fashion. It is something that we're very much committed to at the agency. Of course, trying to balance the need to get the data out quickly as possible while making sure it's complete enough to send a proper signal.
If there's a way that we can see some data or a little bit of data at the council level before next September, that would be great. Just to see what the trends are and everything else, not to hold you totally accountable to it, but that would be great. So when you had the Healthy NYC Symposium, which I attended, you showed, there were a couple of maps there that you showed. Are those in the report, those maps? Were they included? I'm not sure that they were.
We would be happy to send those maps in follow-up. I believe they may have been linked in the report, but they weren't specifically.
If you could send us, because I noticed, one map that I saw took in a large part of my district, so that's why I want to see what I can do. And the other thing, too, is to take advantage of each of us as council members in terms of our particular districts. We may be able to help with a number of things. And which brings me to the partnerships and community engagement. The Healthy NYC Annual Report highlights the importance of partnerships in achieving the campaign's goals. Can you elaborate on the specific roles and responsibilities of the supporters and champions?
Absolutely, we'd be happy to do that. We really do acknowledge and recognize that Healthy NYC has to be a multi-sectoral, multi-agency partnership. The health department alone cannot move the city towards the goals, and so we're thankful for all of our sister agency partners and external stakeholders as well. There's two categories of external partners for Healthy NYC. There's a supporter category, and there's also a champion category. We now have almost 30 champions and supporters signed up for Healthy NYC, and we continue to bring in new champions and supporters as the campaign continues. So I expect that number to be even higher the next time I'm here to testify in front of council. I would also just acknowledge that some of those partners include organizations that have been doing this work for quite some time, including the American Cancer Society, the American Heart Association, and many others. And so we're thankful to have partners like them, again, knowing that the more we can get all of the rows rowing in the same direction across society and across sectors, the more likely we are to achieve our goal of extending life expectancy to at least 83 years by 2030.
What's the difference between a supporter and a champion?
Supporters are really helping to get the message out across their partnerships. They're thinking as employers often about what they can specifically do in their own realm. And champions are really choosing to focus on one particular issue or one particular commitment that they're making, and often involve resources from that organization as well. But we see both supporters and champions as really important and noteworthy partners to this campaign.
No, because I went through the list, and I'm very impressed. The New York Academy of Medicine, which you should totally utilize.
Yes.
I met the president recently, and she said that she would love to partner with us on anything that they can do. So we should, they do a lot of, they have a lot of data, so we should definitely utilize them and see what they can contribute. The other, I saw NYU was on there. Again, these are also institutions that have clinical trials for many things that we should talk to them about, and they want to, they want to contribute. I mean, I've spoken to a lot of them. A number of people have approached me. So if there's any way that I can help in that regard, we can talk about that. I noticed H&H was not on the list. Is there a reason for that, or?
H&H is definitely a partner for Healthy NYC. They've been involved in many different ways, whether it's data or partnership in other ways. And I will also acknowledge, NYM and the President Ann Kurth have been great partners to us already. They hosted our September 25th symposium on addressing maternal health and are partnering with us on multiple different research and other types of investigations. I will say the clinical trials piece that you just raised, Chair Shulman, is really important. That is much more in the realm of health and hospitals than us at the health department, but we have lots of different ways that we're already collaborating with health and hospitals as well.
Okay, no, I appreciate that. And I also wanted to ask you, I know you mentioned the opioid deaths and fentanyl. Can you give us an update on the status of the opioid settlement money? Because that seems to be a little bit nebulous.
We would be happy to do that in follow-up, Chair Shulman. We also acknowledge that there was a pretty significant release in September that really described all of the different areas of investment for the opioid settlement dollars, and the health department has been really, again, excited to partner with the city and the state around getting those dollars to impact the areas, the neighborhoods, the populations that need to be prioritized to reduce the rates of overdose. I'll also mention that just in the first 3 quarters of 2024, the health department has distributed over 220,000 naloxone kits, which is much, much larger than last year. And there are other areas of focus for us, including the Relay program, increasing access to medically assisted treatment, and many other programs, including syringe exchange, that really are what we would consider extremely high impact public health programs to address the overdose epidemic.
And I did see that the Office of the Chief Medical Examiner was at the symposium, and I presume you guys work with them as well, because that's very important. I know that their data and what they see is part of the mix here.
That's
DOHMH has acknowledged the persistent and unacceptable racial disparities in maternal mortality, which is a big issue for the council. Can you elaborate on the concrete actions DOHMH is taking or will take to ensure that the strategies employed to reduce maternal mortality are culturally competent and responsive to the specific needs and concerns of the communities most impacted by these disparities? Bless you.
Absolutely. This is a huge priority for us. Of all the 7 drivers listed for the reduced life expectancy and for our goal of getting it to 83 years by 2030, you'll note that Black women and pregnant people are specifically named in our maternal health goal for Healthy NYC, and that is in large part, again, because of the persistent racial inequities in the rates of maternal mortality for Black New Yorkers. One of the things that we're doing, of course, is continuing the work of our Maternal Mortality Review Committee. That committee brings together experts from all over New York City who rigorously and extensively review every single maternal death and evaluate the contributors and the causes of that maternal death. They also designate whether or not that death is considered to be preventable. And almost 3 of 4 deaths are considered preventable, particularly for Black New Yorkers. So we do have work to do. The MMRC's report that was released this September lists out over 25 recommendations across really most sectors. So healthcare, policymakers, community-based organizations, health departments, and many other stakeholders. There are recommendations for each of those groups on how they can contribute towards protecting the lives of pregnant people and reducing the rates of mortality. And then the other work that we're doing is on a maternal home collaborative model that seeks to decrease the silos between community, healthcare, and other organizations to really, again, protect the lives of pregnant people and to fund and resource the interventions that we know are evidence-based and save lives of women. So those efforts are ongoing, and we'd be happy to follow up with council to discuss some of those recommendations in detail.
No, I appreciate that. I just, before I go to my next question, I want to recognize that we've been joined by council members De La Rosa, Menon, and Mamarato. DOHMH states that its goal of Healthy NYC is to reduce homicide deaths by 30% by 2030 by investing in communities much impacted by violence. What specific type of investments will DOHMH be making to address this issue?
Thank you for that question. The work on interrupting violence has been a big priority for the health department for many years. We currently have a program called the Hospital Violence Intervention Program, or HVIP, that we fund in partnership with DYCD. And what we do in that program is for anyone who is a victim of firearm-related injury that comes into the hospitals that are partners in our HVIP program, they have a peer who is there to counsel them and to support them as they transition out of the hospital. This is an evidence-based program that's been implemented in many cities around the country, and that program does continue at the health department at this time. We are responsible in particular for the programmatic data, for the technical assistance, for the trainings, and other aspects of the program, and that work is very, very important to us in contributing towards reducing violence-related injury.
So there's two more things I want to ask about, then I'm going to actually turn it over to my colleagues and come back. So one is, I'm guessing that you know about the trauma hospital that Councilmember Brooks Powers is trying to put in the Rockaways, because I did see from the map that healthcare disparities in that part of Queens is really bad, and I've been out there, and I will tell you that if you have a major illness or a major injury, your chances of surviving are much less in Southeast Queens than any place else. So I presume you're supportive of that effort, and I don't know if you have any partnership in that. I'm just asking the question.
Thank you for asking the question. We do not currently have any plans specifically around that, mostly because the health department doesn't operate any programs around. We don't operate emergency rooms or trauma-related programs. However, we'd be happy to learn more about those efforts, and we certainly do.
You should be in the room.
Thank you. I'd be happy to.
And then, actually, you know what? I'm going to turn it over to my Councilmember Zhuang is asking the first set of questions. I'll circle back after.
Thank you, Chair.
Thank you.
Thank you, Chair. I do see the source from House NYC is showing the data saying the Asian and Pacific Islander of New York is very low. I don't understand why it's very low, because 18% of New Yorkers are Asians.
Hi, I'm not sure what part of the report you're referring to.
There's the chart over here.
Oh, okay. Oh, the original.
They're showing Latino, white, and black, which is good, but the white Asian is missing.
Thank you for bringing this up. In the most recent data that we've prepared, we were able to calculate life expectancy for the Asian population. And so that is a change we've been able to make going forward.
Okay, so what's the data now? Like, what's the life expectancy?
The life expectancy among Asians in New York City is the highest. It's 86 years.
Okay. Okay, and also recently I see on a news saying a new study point out that among Asian groups in United States, Chinese Americans have the highest lung cancer death rate. Probably around 2,300 people died from lung cancer in New York City each year, and about 4,400 people are newly diagnosed with lung cancer. Did you guys do any study about any lung cancer?
We'd be happy to share some more of that specific data with you in follow-up. We have been looking specifically at screenable cancers as part of the Healthy NYC goal. Lung cancer is one of those screenable cancers. And so part of our effort has really been to increase access to CT scan screening for lung cancer, and to make sure that we're doing so in a way, again, that is equitable. What we have seen so far, to my knowledge, is that the rate of lung cancer deaths is the highest for men and is the highest for Black people in New York City. But we would be happy to follow up with you to understand a little bit better, perhaps in your district, what the access to lung cancer screening is, and if there are any additional efforts that we could do to make sure that education around access to lung cancer screening is supported as well.
Thank you, Commissioner, and I'm very happy you said you guys are doing data analysis by district, by areas. I do think my area don't get enough resources about screening program. It's very hard for the community, especially immigrant community, doesn't speak the language, doesn't have the resource, doesn't know where to go to find help. So I hope you guys can put more resources in our neighborhood. We have the largest, my district has the largest Chinese American, even Queens has the largest Asian, but my district has the largest Chinese American population, and very often they don't get a resource, and then 70% of them probably doesn't speak any English.
Thank you so much, Council Member. Yes, we do have resources on qualifying for lung cancer screening in multiple languages, and we have several different resources in that realm that we could share with you and follow up, and we'd be happy to talk more about how we can partner on those efforts for prevention.
Thank you, and then we'll follow up with you also. Thank you.
Okay, thank you. Councilmember Narcisse?
Good morning, and thank you, Chair. My question is about around young people. I want to start with young people. What efforts are being made to involve young people in shaping healthy NYC programs to address their unique health needs? And one of the things, too, before you answer that question, I don't see enough teaching being done around the schools, because if you want to change the future, you have to involve young people, and I have not seen that enough around our city. Can you answer the question I asked?
Thank you so much for the question, Chair Narcisse. On the first question about how are we engaging youth, one of the areas that we're focusing on right now is youth mental health. And so we have a number of surveys, town halls, and programs that are really focused on engaging New York City youth around their mental health and behavioral health needs, their risks of suicide and drug use, and a number of other areas. And our mental hygiene division has been really leading the way in some of that work, again, both through surveys and surveillance, as well as direct engagement of youth for their own ideas about how we can best partner and support them. In terms of your second question around how we engage New York City public schools, there are a few different ways that we do that. One of the areas of focus is in asthma programming, where we partner with school nurses and asthma counselors in multiple different schools across the city. Although we would love to be able to do it in more schools, we are doing that work in schools that have high rates of asthma, and that is one of the areas of focus for us. We also, of course, have a number of sexual health areas of focus within our schools as well.
Thank you. That's very important to involve young people in everything we do if we want to change the future, starting with all the diseases, other diseases are we talking about, the chronic illnesses. Those young folks need to know and early on so they can make the right decision. And when it comes to food and diet and exercising, those are the things we need to implement in our culture for the future generation. There is a study that I heard, I cannot recall exactly. I don't want to promote the radio, but I know it was one of the radio. There is an increase in diabetes around our nation. I'm talking about the whole United States of America. But there is no increase in medication, like people applying beyond medication. Why do you think so?
We'd be happy to look at the New York City specific data for that question.
Because I know New York City is big, so that's why I was coming to.
It is a big city. So we'd be happy to follow up with you to understand more the reference and the research, and then also share some of the New York City specific data. We have in New York City seen an increase in diabetes prevalence over the past 20 years, and it's again not equitable. It's some neighborhoods.
It's not.
More so than others. And access to health care, again, is one of the most important issues as well for addressing diabetes, in addition to all the things we do to try to shape the food environment and do the preventative work, which is in large part our role in the health.
You just spoke my language, preventive approach. If we don't do that, we're not going anywhere. And the food, the housing, I'm with you with that. May I? Because I have some other question that I want to. As the current funding levels sufficient to achieve the healthy NYC goals? If not, what additional resources are needed?
Thank you for asking that question, Chair Narcisse. We always look forward to partnering with Council around making sure that our goals are achievable and that the resources are adequate. There is not a line item budget in the Health Department budget for Healthy NYC per se, but we really do integrate the work towards the goals of Healthy NYC into the work of many of our bureaus, divisions, and 7,000 staff. And so, bless you, even though there's not a line item, we are working to make sure that resources are really attributed to the areas where we need to focus. I will mention one of our bureaus, the Chronic Disease Bureau. The budget of that bureau is about $17 million per year. And we have other bureaus that we can follow up with you as well that really align with the 7 goals of Healthy NYC. So we're doing our best to make sure that we have that we use the resources we have and align them with the 7 drivers of lowered life expectancy so that we get to 83 years by 2030.
Okay, what public education campaigns are being conducted to increase awareness of a Healthy NYC programs, if so? Please
Thank
share.
you for that question. Yes, last spring we did do a public-facing campaign around Healthy NYC. It included videos, social media, and other types of communications tools to get the word out to the public across New York City about Healthy NYC and the things that contribute towards health and longevity in the city. So that campaign was last spring.
Do you share that with the Department of Education? Those videos, because that's when I'm bringing those young folks back.
We can follow up with you about where those campaign tools and resources were shared. But my understanding was that was much more of a general public-facing campaign, not targeted to any particular institution.
Okay. Can you provide specific examples of community feedback that have shaped or altered the direction of Healthy NYC?
Thank you so much for that question. I think we have more work to do in that realm, but we do have several approaches that we use to get feedback from communities directly about Healthy NYC. So some of that happens in advisory councils or community board meetings that we attend. Some of that also happens in regular meetings with some of our community-based partners. And then we also did have, for several years, a very lengthy community engagement process across the city where we really asked New Yorkers specifically what their priorities were for healthy, for their own health, and that did contribute in some ways to the development of Healthy NYC. The last thing that I'll just mention in this particular realm is we do hope to do more community engagement going forward around Healthy NYC, and some of our champions and supporters for Healthy NYC are community-based organizations as well.
Okay, my last question.
Sure.
Because that's on my hearing.
Okay.
As a nurse, I'm excited to ask question because I want to see what my chair is saying, that we want to increase the age, like when we're talking about Black and brown community, we have to play catch up all the time, and if we can change that, so that's the reason I'm always excited to see you and see all the people that are doing the work. The last one is on the survey. Is any active survey going around for the community that we see in the most deficit, and how can we address those if you have those survey results?
Thank you so much for that question. You are speaking public health. We really appreciate, we find our surveys and community engagement work to be so critical for shaping our work. And I'll also just tell you, I think our focus on racial equity and the very, very shortened life expectancy of Black New Yorkers is important. I also want to make sure we acknowledge that that is not the fault of Black New Yorkers, that there are policy choices, resources, investments, et cetera. The last thing we want to do is to blame Black New Yorkers. So I do want to just underline that this is about social and structural systems that have created shortened life expectancy for Black New Yorkers over many, many generations. And I would like to invite my colleague, Gretchen Van Wee, to share a little more about the surveys in the communities that we want to prioritize.
Good morning again. Every year we have something called the Community Health Survey that we field. This is a very robust survey that allows us to identify at 59 neighborhoods across the city what's happening in terms of the health of New Yorkers. We also do surveys in the schools, in the middle schools, in the high schools, and we complement this with a fairly new tool that's a health panel that we do surveys of many times a year. So we're broadly looking at general characteristics of health, and we're also asking people for their opinions on different kinds of things and going deeper on certain topics. I'm happy to get you a longer list of what all of those tools are.
Yeah, because I'm interested in all the chronic illnesses that we face in our community, having hospital closing in our communities, not facing, the only, I'm not going there because that's another subject for the downstate, but anyway, so thank you, and I'm looking forward for that. Thanks, Chair.
Thank you, Councilmember Narcisse. Councilmember Riley?
Thank you, Chair Shulman. How you doing, Commissioner? So I just want to piggyback off of Councilmember Narcisse, and happy to hear about the surveys. I represent the largest retirement community in the nation, which is Co-op City, which is built around the New England Three-Way. So chronic disease and chronic illnesses is something that's really, really important to my community. Have you done any outreach to the community in Co-op City?
Thank you so much for that question, Councilmember Riley. We are very aligned with you around wanting to prioritize neighborhoods that suffer from a higher burden of disease. And thank you for highlighting some of the challenges in Co-op City. I might actually turn to my colleague Liz Solomon, who helps to lead many of our chronic disease programs, to share more about any specific outreach in Co-op City.
I actually don't have anything to add in terms of outreach in Co-op City, but we do have a wide range of chronic disease prevention programs and policies, and there is a lot of engagement within those programs. For example, we have health bucks that are coupons that are distributed across the city, can be used for fruit and vegetable purchases at New York City farmers markets. And that program, we work with over 600 programs in community-based organizations to distribute the health bucks, and we meet with them annually to get feedback on that program. So that's an example of how we might approach.
So maybe we could connect after this meeting to figure out how we could do some outreach in Co-op City. I usually hold a community conversation every month, and I usually move it around the district. I'm thinking about doing one focused specifically on health, and would love if you guys will come by, and pretty much be a part of that. I want to go into my bill, Intro 641. Can you please describe the DOHMH inspection and enforcement scheme for nutrition standards and menu options for kid menus within restaurants in New York City?
Thank you so much for the question, Council Member. We do have a series of regulatory and other responsibilities around monitoring the food environment for children, for DOE and other sister agencies. This one I'm going to also pass to my colleague Liz Solomon to describe a little more in detail how we do that work.
Thank you, Acting Commissioner Morrison. Thank you for that question. We do have an enforcement division in our agency that has inspectors who inspect restaurants, and nutrition requirements are part of that inspection. We are very supportive of the bill, the intention of the bill. As Dr. Morris mentioned, as written, the bill is not enforceable from the health department, and restaurants really would not be able to comply with it.
Chair, if I may. Chair Shulman? May I? Thank you. Can you explain the enforcement concerns with this legislation that you have?
Yes, the data needed for both for enforcement is not required to be disclosed by all restaurants per FDA rules. So the health department would not have the data to enforce the bill.
Is there any additional resources, if any, that could be implemented in this legislation for it to move forward?
Well, we would love to continue to work with council to amend the bill, to consider ways that we can work together to support child nutrition in the restaurant setting and support access for healthy meals for children.
Okay. Could we follow up as soon as possible to discuss?
We would love to follow up with further conversation.
And my last question, Commissioner, you spoke about fentanyl test strips, I believe. Could you please describe the timeline on that and the substances that you could utilize those test strips on?
Absolutely. We'd be happy to follow up with more details or ways in which community partners can request those fentanyl test strips. They're specific for fentanyl. There are other more advanced and extensive test strips that we can also offer in unique cases, but we'd be happy to follow up with you offline
Thank you.
about access to those as well as to naloxone.
Thank you so much. Thank you, Chair.
Councilmember Abreu.
Thank you so much, Chair Shulman. Thank you, Commissioner, for testifying today. I have a question. Do you have the number of New Yorkers who are currently living with sleep apnea?
Thank you so much for the question, Councilmember Abreu. That is not data that we currently track closely or are required to track by any means. The data on the prevalence of sleep apnea is difficult to access for a number of reasons, particularly because we are not a health care organization specifically that looks at those data in the way that you may be requesting. However, there is certainly there are a number of different ways in which we do look at other chronic diseases across the city, but we do not currently look at sleep apnea prevalence.
I think that the fact that the Department of Health as an agency doesn't have data on sleep apnea speaks to the level of inattention that there has been to sleep apnea in New York City for a very long time. And that's why this bill, our campaign about this being more than a snore is very important. I think that folks don't tend to realize that when they're asleep and they're snoring, you usually think, oh, I had a good sleep, I was snoring all night. No. Not having air get through to the places, not having oxygen to your brain or having air get blocked through the passageways can have very serious debilitating consequences. And as a city, I think that we need to have this data, and not only have this data, use it to inform intervention. And that's why we're doing a bill that would provide a free screening for New Yorkers who are uninsured or whose insurance would require them to pay $100 or more out of pocket. I want to thank you for the feedback. While I understand that DOHMH may not directly have access to clinical testing, our bill envisions a program that works with H&H or other contracted parties to make this pilot possible and reach uninsured and underinsured New Yorkers. So I certainly hope we can discuss how to make this possible, especially as we gear up for another budget cycle in the coming months. But I wanted to ask one last question, is whether there are current initiatives by DOHMH or informational materials available by DOHMH that discuss sleep apnea and risks associated with sleep apnea.
Thank you for the question. I'll start by saying, I am a practicing internal medicine physician. I've been practicing for over 15 years in multiple cities. It is very, very common to unfortunately see sleep apnea as a condition that patients may come into the hospital with. It may contribute to high blood pressure and to all the other complications that you referenced. So as a clinician, it is a disease that I take extremely seriously. Because it is a complex disease to diagnose and to treat, it really is best addressed as a part of an integrated healthcare delivery system. And the reason I say that is because often folks who have sleep apnea may have other health issues as well that need to be screened for and addressed. I don't know if that's the case for you, council member, but that is the case often for older folks in particular. They may have other coexisting chronic conditions that need to be addressed. And so kind of, doing the screening for sleep apnea in isolation without access to all the other healthcare delivery tools that are really needed to best address the needs of those patients is not ideal from our perspective. But I would orient you towards the really clear testimony that Health and Hospitals submitted. They do have a sleep apnea program that is currently implemented across 5 hospitals in Health and Hospitals. 5 of the 11 hospitals in the Health and Hospital system, and we do really feel that this is a healthcare best addressed by the healthcare delivery system rather than by us at the health department to make sure it's a comprehensive program.
So, sorry, you didn't answer my question.
Sure.
Are there current initiatives or informational materials available by DOHMH that discuss sleep apnea?
What I would say is that
Yes or no?
sleep apnea isn't one of the top drivers of the reduced life expectancy that we've seen. So our goal with Healthy NYC is to extend life expectancy to 83 years or longer by 2030. The 7 drivers really are the ones that are the top drivers of shortened life expectancy. Sleep apnea is not one of those drivers, and so it's not to say it's not important. It is to say it's not one of the areas of focus within Healthy NYC.
It needs to be one of the focus areas for our city. When you have 1 in 4 adults at the ages of 30 to 70 nationally, that's 30 million. 23 million of those 30 million don't realize that they have sleep apnea. If we were to apply those national standards to New York City, that would result in 1.6 million New Yorkers. 1.6 million New Yorkers potentially could be living with sleep apnea right now. It can result in stroke, hypertension. If those are things that we can't even get the basic data for as a city, I think that is very concerning for us. And that's why we're launching this campaign for More Than a Snore, and I hope that we can reach a solution that would be to the benefit of New Yorkers. Thank you very much, Chair.
We would be happy to speak more with you, Councilmember Abreu, about how we could collaborate.
Thank you. I look forward to that.
Thank you. Councilmember Mamarato?
Thank you, Chair. So as a mom of an 8-year-old who has very limited food options, chicken fingers and pasta with butter, and culturally, most of my restaurants in my district are Italian restaurants, so those are really our only options. I just want to know when 641 passes, how are you going to roll out information to, like, what's going to be the outreach to these restaurants? Are you going to send them, like, pamphlets or do some kind of, like, email outreach just to educate them on other options? What is that kind of looking like?
Thank you for the question, Councilmember. I'll pass this one to my colleague, Liz Solomon.
Thank you for the question. We typically provide education for restaurants for when we first post a rule. There's typically about a year of education. So for example, for the Sweet Truth Act, we have published a guidance that's on our website, and it does get sent to all restaurants. We are also available for any questions and support. We really do want to support the restaurants in complying with any policies that are enacted.
I'd like to help you guys out when the time does come, because I feel like it's very important, and I don't want just limited options, especially in my district and my community. I do want to have a conversation now about this needle exchange program. Are there any programs in District 13 currently?
Thanks so much for the question. We can follow up with you. I don't have an answer at the moment, but we'd be happy to follow up with you about that.
Okay. Is there a way or a website to see if we can look that up ourselves?
We'd be happy to follow up with you.
Okay. Just for the record, I don't condone needle syringe exchange programs in my district. I feel like normalizing drug use. I've had way too many people within my community whose lives and families were destroyed by drug use, and I just feel like a needle exchange program is only enabling the problem, and we do not welcome that in my district. So,
I acknowledge your position, Council Member. It is a very well-studied public health intervention that saved lives, but we do understand your concern.
Thank you for that, but it's just a statement, and yeah, so thank you.
I'm going to hand it over in a second to Councilmember Narcisse. I just wanted to clarify that we're having a hearing today on this legislation. It's the first step in the process, and there's a legislative process that we go through, so there's no guarantee of where these bills are going to go. So I just wanted to clarify that. Councilmember Narcisse had a couple of follow-up questions, and then I do. Thank you.
One of the things that we always talk about, right, in healthcare, hypertension is a big thing for us, right? But I recently worked on Intro 996 to create access around for the sphygmomanometer to be accessible to people, like within their communities, and as well as giving educational information so they can make the best decision. How you see that bill going, and how that can be helpful in the process of preventive care.
Thank you for the for the question, Chair. We would be happy to follow up with you offline about Intro 996. We do have guidance from the Health Department about taking home blood pressure, how to do so, how to collaborate with your primary care doctor. So this is an area that we have worked on in the past, but we'd be happy to follow up separately about that specific bill.
Okay. One of the things that caught my attention in your statement, through improvements in sanitation, that's how you're going to improve our life expectancy, right? Improvement in sanitation, water infrastructure, and vaccinations. With what's going on, the narrative that's going around right now more than ever in our country, and bring it to New York City, how you see that going to affect us for people that against vaccinations?
Thank you for the question. We did, experience a lot of that during the COVID pandemic. There are lots of different communities who have different perspectives on the value of certain public health interventions. For our current Healthy NYC campaign and the 7 main drivers of shortened life expectancy, we do have a number of different interventions that we think are the real path forward for improving life expectancy. And COVID vaccines, flu vaccines, other, effective and safe public health interventions are definitely a part of what we will continue to support across New York City to protect the health of New Yorkers. And so, our perspective again is that the COVID vaccine, flu vaccines, these are safe and effective interventions to protect the health of the public during respiratory viral season and beyond.
The reason I asked that question is because unfortunately, we're talking about COVID like almost in the past for what we've been through, but we live in a global world, and I am so concerned that is increasing more and more, that people that see vaccination, it's something that we, after all the study proven that it works for human being on this planet. So whatever we can do to encourage, while I respect those that feel like this is what I want to do, but in general perspective, in the global way of seeing things, I think we need to stay kind of focused on sending advertisement out, whatever we do, videos, anything to encourage people to understand that is part of our life. So thank you for your work, and I do appreciate you. Thank you.
Thank you.
Okay, I just wanted to ask a couple of follow-up questions. One is the 7 strategy maps developed by DOHMH, and you mentioned, it's mentioned, are those public or are those just given to us?
Thank you for that question. We are just finalizing the strategy maps, and they will be publicly available in the coming weeks.
Okay, I appreciate that. Let us know. And also, just a quick follow-up on Councilmember Narcise's question. In general, Healthy NYC and the new administration that's coming in, is there any special thinking around that, or just to make sure that Healthy NYC, that we're able to move forward with plans that we have? I mean, just as a general thought about that.
Our perspective is that Healthy NYC really is an evidence-based and a data-driven approach for how we improve life expectancy across New York City. We definitely see it was envisioned as an initiative and a framework that would transcend, administrations, because it is a long-term goal. And so our plan is to continue to partner with all of our stakeholders around advancing the goals of Healthy NYC and really achieving that goal of 83 years by 2030.
Because one of the issues, I know that part of Healthy NYC is surveillance, and plus there's some issues around HN51. I'm not going to get into a whole thing around that, but at some point we will. But, the federal government may pull back on surveillance. I mean, I just want to make sure that, New York City is inoculated about some of the negative impacts that may occur. So.
Thank you for raising that question, Chair Schulman. We'd be happy to talk more offline around plans around the new federal administration transitioning in. From our perspective, again, we are prepared to continue to push forward with the goals of Healthy NYC, and we know that the science and public health values that helped us to set those goals will still be true, and that the interventions that we have worked on developing and the strategy maps and beyond will still be the evidence-based interventions that get us to our goal of 83 years by 2030.
So I do have something I want to say, but I want to first acknowledge two things. One is acknowledge we've been joined by Councilmember Feliz, and he has a question. So let him ask a question now, come back. And
Thank you so much, Chair, for this hearing. So a few questions, somewhat unrelated to the two bills before us today. So I have a few questions about, and I guess I'll be following up with Councilmember Morato's questions. A few questions about the needle exchange programs managed by the Department of Health. And I'm asking these questions because there's a few needle exchange programs in my district. These exchange programs are life-saving, but we need to make sure we're placing them in a way that, in areas where it's responsible to place them at. If we know that having these programs could create issues in the community, why place them in front of a children's library or in front of a children's playground when we know the overall result is having hundreds of needles every single day in that surrounding community? And of course, cleaning them up is great, but the next day having another 100, which is obviously not a real solution. So a few questions. Approximately how many needle exchange programs, mobile needle exchange programs, do we have? And also, are these programs truly exchange programs, or do we just provide them? Call them exchange, but we're not really exchanging anything.
Thank you for the question, Council Member. We do have a number of different mobile programs that are designed really to engage people where they are. We'd be happy to follow up with you about the specific numbers of how many of those programs we offer.
How many of them are exchange programs? What percentage, if you were to guess? Exchange versus calling them exchange programs, but not really exchanging needles, just providing them. Very misleading name, by the way.
We would be happy to follow up with you on those specifics.
Are there any rules for the placement of these programs, such as not placing them in front of a children's library or in front of elementary school when we know there's going to be hundreds of needles in the surrounding community?
I do appreciate the concern, and we certainly are aligned with you around wanting to make sure that these programs are placed in the locations where they can be the most impactful and also are safe for the communities where they are located. So we very much are aligned on intent of both wanting to significantly decrease the rate of overdose across the city, which, as was noted in the 2021 Healthy NYC data, we had significant increases in overdose amongst Black and Hispanic communities in particular. And so we want to change that trend, and we know that we need to implement interventions that are going to be life-saving, and do so in a way that is safe for the public. So we're aligned with you in terms of the intent and in terms of achieving the Healthy NYC goal. We'd be happy to follow up with you about any specifics around the proportion of what kind of programs we offer for overdose prevention.
Yeah, and I guess to be clear, I agree these programs are life-saving, but I guess my points are about the placement of these programs. If we know placing them in certain areas will bring hundreds of needles on a daily basis, why place them in front of a children's playground or in front of a children's library or elementary school? If I could just ask 2 to 3 more questions briefly. 2 more, okay, cool, that's fair. Do you think there should be rules on the placement of these programs, such as not placing them in front of a children's playground, or do you think that's good policy to place them in front of a children's playground?
I would be happy to follow up with more specifics on the rules that decide.
But the question is, do you think there should be rules on the placement of these programs? Or do you think it's good policy, for example, to place them in front of a children's playground?
We do partner closely with the state and OASAS on both certification of the programs that are intended to reduce overdose and increase access to medically assisted treatment. And so we do partner with our state colleagues on some of that. We would have to follow up with you on any of the specifics about how placement of the programs happens.
And final question, what are some of the problems that are foreseeable if we have them in front of a children's playground or in front of a children's library or elementary school? Do you see any public health crisis-related problems that could be created?
I do think that there are significant public and general safety concerns if we continue to have such high rates of overdose for
But on the
New
placement,
Yorkers.
not on the issue, on the placement of these programs.
And I think, I think the best thing that I can offer at this point is to follow up with you about any specific programs that are placed in locations that you're concerned about, and share more information with you directly about how that process happens.
All right, thank you. Thank you so much for the information. And again, I look forward to talking about, chatting, I guess, offline. Thank you, Chair, for the additional questions. Chatting offline about needle exchange programs, not only in front of the Bronx Library Center in my district. Over 500 unaccompanied minors visited every single day. Also in East Tremont, a needle exchange program
Councilmember.
literally right in front of a children's playground. It is irresponsible and mind-boggling, and I expect better from health experts.
Okay, thank you. So I want to say thank you for Healthy NYC is off to a good start. I look forward to even greater accomplishments along the way. At a previous hearing, I said something, I'm going to reiterate it here, that you've set the bar for your colleagues in other agencies because you come very well prepared, even for things that are not necessarily on the agenda, so I want to say that. I want to thank the mayor for his commitment to healthcare, and I want to particularly thank Deputy Mayor Ann Williams-Isom for her dedication and devotion to and passion for health. So with that, thank you. We're going to take a 5-minute recess and then do the public hearing. Thank you.
Thank you.
Can everybody settle down and find a seat? Everybody settle down and find a seat, please. We are getting ready to begin. Everybody settle down and find a seat, please.
Ready? Ready? Okay. I'm now going to open the hearing for public testimony. I remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant-at-Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant-at-Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on today's oversight topic of Healthy NYC or on the legislation being considered today, Introduction 641 and Introduction 1047. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant-at-Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. Is this first panel? Yes. Okay. First panel is Pasquale Ramo. Okay, just have a seat at the table. We're gonna, Bernard O'Brien, Emily Lee, okay. Sarah Kim, Jacob Zaitchik, and just remember, please we have a lot of people testifying today, please keep it to 2 minutes. If you have more testimony to submit, you can always submit it in written form within 72 hours. Pasquale, you want to go first?
Hi. Thank you for the opportunity to testify. My name is Dr. Pasquale Ramo. I'm an associate professor in the Department of Population Health at NYU Grossman School of Medicine. I conduct scientific research that informs policies and public health programs like this, seeking to support healthy dietary behaviors. And one area of my focus specifically is evaluating how policies like this, mandating changes to restaurant menus, impacts food purchasing behaviors. So I support the proposed legislation for a few reasons. The majority of children's meals contain excess calories, sodium, and saturated fat relative to expert nutrition recommendations. And that's a problem because fast food comprises about 15% of children's daily energy intake in the US, and 1 in 3 kids is getting fast food on any given day. So, in addition, existing policy options for addressing restaurant food intake among children are largely inadequate because nutrition standards specified in these laws do not meet expert nutrition standards, specifically for kids' beverages and meals. And also, we see that compliance with a lot of these beverage laws in the US is low, suggesting that modifications and extensions are merited. And then more specifically related to my research, I do a lot related to research promoting healthy behaviors, including nudges and default options for parents and caregivers of young children, especially and including parents and caregivers with lower income. And what we found briefly is that restrictions on products like flavored milk and serving sizes of juice could contribute to parents purchasing more healthy items for their children and meals from restaurants specifically in a way that the existing legislation doesn't support previous beverage default laws. And that parents and caregivers too are likely to support such legislation in general and we find that when given the choice of beverages, different healthy beverages on children's menus, parents may, when given the choice of any type of beverage, parents may order other unhealthy beverages for their children in lieu of soda, even with some of the existing paradigms like sweet tea or lemonade, suggesting that the suggestion of these policies depends on how we classify them as healthy. Thank you.
Good afternoon. I'm Emily Lee, a project coordinator at Korean Community Services. Since 1973, KCS has served Korean immigrants, other Asian American and Pacific Islanders, and Hispanic and Latino communities by providing a vast range of services, including healthcare navigation, disease prevention and management, and food and nutrition services. As someone who works closely with Asian Americans and other people of color impacted by diet-related diseases, I want to focus my testimony here on the hidden epidemic of metabolic dysfunction-associated steatotic liver disease, otherwise known as MASLD. More and more children and youth are affected by MASLD, which shares common metabolic risk factors with obesity, diabetes, and cardiovascular disease. In fact, 1 in 10 children in the US and more than 30% of people worldwide have this condition. While it can occur in children from any racial and ethnic groups, it's more prevalent among Hispanic and Asian American children. If left untreated, MASLD can progress to serious conditions like fibrosis, cirrhosis, and even liver cancer. What's especially challenging is that most people with the condition are asymptomatic and it can develop over many years unnoticed. And screening for MASLD and related conditions is not as common or convenient as screening for high blood pressure or glucose levels. Much of my daily work in Flushing addresses hepatitis B infection and its disproportionate impact on the Asian American community. It's critically important that we prevent liver disease and its often irreversible damage with better community education, improved screening, and policies that address underlying risk factors including diet-related conditions. Intro 641 is a good example of a policy that can modify the New York City food environment to guide families to healthier choices for their children, helping to reduce the risk factors for MASLD and other conditions. Thank you.
Thank you. Who's next? Just state your name.
My name is Jacob Zajcik. I'm with the American Heart Association. On behalf of the American Heart Association, thank you for the opportunity to provide testimony on oversight of Healthy NYC and in support of Intro 641. Childhood obesity in the United States remains high, and recent findings show that nearly 40% of New York public school children in grades K through 8 are overweight or obese. According to the Health Department data, the rate of obesity among Black students is about 65% greater than among white students. Among Latino students, that rate is 97% greater than among white students. 85% of U.S. households eat out on average 5 times per week. When kids and teens eat out, they consume more calories than when they eat non-restaurant foods. Studies show that restaurants can offer healthy menu options without losing revenue. Intro 641 has an overwhelming support from New Yorkers, including a supermajority of the New York City Council. A poll commissioned by the Center for Science and the Public Interest, CSPI, highlighted that 84% of New Yorkers are supportive of a policy that would set a requirement for 2 children's meals to meet nutrition standards. Stuck over here. There's also over 110 organizations representing public health, neighborhood nonprofits, restaurants, and faith-based organizations who have signed on to support this bill. Many of these great advocates are here today. The American Heart Association is proud to join with the majority of City Council and thousands of New Yorkers who are in support of Intro 641 to ensure that healthier choice can be made easier when families are eating out in restaurants. In addition to our support for Intro 641, we want to say that we are a proud Healthy NYC partner. As you heard, Healthy NYC is the city's vision on how to improve life expectancy and create a healthier city for all. On behalf of the American Heart Association, thank you, Chair Schulman and the entire Health Committee for the opportunity to testify today. The American Heart Association looks forward to working with the Department of Health and Mental Hygiene to meet the goals of Healthy NYC and continues to be supportive of Intro 641, and we hope the Health Committee can support the bill also. Thank you.
Good afternoon, Council Chair Schulman. My name is Sarah Kim. I'm the Program Director at the Public Health Research Center at Korean Community Services. Thank you for this opportunity to speak today in support of Intro 641. Our children's health is in crisis. Alarming statistics reveal that 40% of New York City public school children are overweight or obese, and more 80% consume at least one sugar-sweetened beverage daily. Poor nutrition contributes to the rise of chronic disease like diabetes, heart disease, and stroke, conditions that remain leading causes of death in New York City, with more than 30,000 deaths in 2022 alone. For Asian Americans in New York City, diabetes is the fifth leading cause of death, with nearly half of our population experiencing diabetes or prediabetes. A New Yorker dies every 9 minutes from diabetes-related causes, while 80% of healthcare spending nationally goes toward treating preventable chronic conditions. To achieve healthy NYC goals of increasing life expectancy to 83 years and reducing diabetes-related deaths by 5% by 2030, we must prioritize nutrition education and education promotion. Community-based organizations like Korean Community Services are key to this effort. By offering culturally appropriate programs improving access to healthy food, we can drive a meaningful change. Passing Intro 641 will enable a culture of health in dining establishments, making nutritious meal choices more accessible for families. This bill has the potential to improve children's cognitive function, academic performance, and long-term health outcomes while reducing healthcare costs. Together, I urge the Council to take this crucial step toward a healthier future for our children and communities. Thank you again for your leadership.
Good morning, Chairperson Schulman and members of the City Council Committee on Health. Thank you for the opportunity to contribute to your oversight of the city's Healthy NYC initiative. My name is Bernard O'Brien. I'm here to present the testimony of Professor Sean Haley at the CUNY Graduate School of Public Health. Professor Haley sends his regrets that he's unable to attend. CUNY School of Public Health, in coordination with other entities, has been working to create an alcohol policy prevention framework for the state of New York. The overarching goal is to reduce excessive drinking and related harms in our city and state. Despite their contribution to morbidity and mortality, the harms associated with alcohol consumption often fly under the radar in discussions of public health policy. Importantly, alcohol use had increased over the 2 decades before the pandemic, and there was a doubling of alcohol-related mortality across the United States. We'd ask you to consider the following. According to the CDC, there are now over 8,000 deaths attributed to alcohol in New York State. Of these, more than 2,000 deaths in New York City were attributed to alcohol, with hundreds of such deaths stemming from liver disease, alcohol-related psychiatric disorders, accidents, and alcohol poisonings. Numerous homicides, suicides, and occurrences of child maltreatment were also linked to alcohol consumption. New York City DOHMA reports that alcohol consumption leads to far more hospital emergency room visits than any other substances. In 2020, the roughly 104,000 emergency room visits attributed to alcohol consumption exceeded the combined number of such visits linked to opioids, cocaine, cannabis, and other substances. Binge drinking in the last 30 days is reported by an average of nearly 20% of adults in New York State. Adjusted for inflation, CDC reports that excessive drinking in New York State imposes $24 billion annually in economic costs, or roughly $1,200 in preventable costs per year. Many of these are absorbed by the city's public health system. Alcohol-related harms also
you could just sum up.
Yeah,
the rest
we're going
to.
I presented written testimony. We're going to provide forthcoming recommendations, which include increasing alcohol taxes to discourage excessive consumption by shifting prices upward. It's interesting that New York City's local alcohol tax has not been adjusted for inflation since 1980. The New York City Independent Budget Office reports that adjusting the city's tax on beer and liquor for inflation and extending the tax to include wine could generate for the city over $30 million annually. So we're going to be submitting additional recommendations, including reducing alcohol advertising seen by youth, and placing a moratorium on New York State laws that increase alcohol availability until such impacts can be measured. So we finally would say that we recommend that the council add alcohol as a standalone category within the city's the Healthy NYC plan, and we look forward to submitting additional recommendations to you next month. So on behalf of Professor Haley, thank you again very much for this opportunity.
Okay, thank you. So before you leave, I have a couple of things. One is Bernard, right?
Yes.
O'Brien. So CUNY School of Public Health, I understand, is a partner on Healthy NYC? That's my understanding. Yes, it is.
Okay, thank you.
So you should talk to whoever it is that is the representative to talk to the city's Department of Health about, because I know they talk about substance use and just having alcohol, make sure that that's part of it. So that's one.
Okay.
The other is KCS part of, do we know? Is KCS part of the Healthy NYC initiative? Do we know?
I think to close work more.
So just contact the Department of Health, if not, because you should be, and I know NYU is, so make sure that whatever it is that you brought here, that you go through and make sure that they know about it, or whatever your reps.
Yeah, they're aware, yes.
Okay. So, because I think that's very important. We need to make sure that everybody has input into this, because it's such an important initiative. So I want to thank everybody here for your testimony. I really appreciate it. And the issue about the alcohol tax, send to us as soon as you can, because we're going to start working on budget stuff. So. KCS is not listed, so you should contact the Department of Health.
Sure.
If you have any issues with that, you can contact the council. We'll put you in touch.
Absolutely.
All right.
Thank you.
Okay.
So thank you very much, all.
Thank you. I would say that with respect to the city's alcohol tax, it's currently less than 2 cents on a standard serving. So we're not talking about, a massive tax.
We go through an exercise where we look for ways to save money, but also ways to increase revenue. So that is something new. So we'd love to, when you send it, we'll
Thank you.
bring it up.
Thank you.
Thank you very much, all. Thank you very much for your testimony. Okay, I'm going to call the next panel, Emily Giron, Monica Bartley. Chesky, I'm sorry, I'm gonna mess up the last name. NDAU, I think it is? Yeah, NDAO. And, yeah. Who else? Hold on. Tiffany Lee and Rabbi Yonah Berman. The person I announced before, Deroy Salam Islamic Cultural Center. Okay. Emily? Which one is Emily? You're Emily, okay. Who's on the, we'll go from, okay, Monica, you want to testify? Start? Mm-hmm.
Good afternoon, Chair Schulman. My name is Monica Bartley. I'm a deaconess in the United Methodist Church, an active participant in United Women in Faith. As a deaconess, I've made a lifetime commitment to alleviate suffering and facilitate the development of full human potential. And that is why I speak to you today in support of Intro 641. It is clear that our children's health is being jeopardized by the lack of healthier meal options in many restaurants. This is particularly concerning for our communities of color, where families often face economic and geographic barriers to healthy eating. Many parents work multiple jobs and simply do not have the time or financial resources to prepare nutritious meals at home. As a result, fast food has become a convenient yet unhealthy option for many families. Intro 641 is a meaningful step towards changing this by requiring New York City restaurants to offer at least 2 default children's meals that meet certain nutritional standards, incorporating more fruits, vegetables, legumes, and whole grains. This bill will make healthier choices more accessible to families. This past June, the New York Annual Conference of the United Methodist Church, representing over 400 member churches across New York City, Long Island, and beyond, overwhelmingly approved a resolution supporting Intra 641. In that spirit, I urge this committee to vote to approve this legislation as soon as possible to protect and improve the health of our children and youth. Thank you for your thoughtful consideration.
Thank you. Next, just take, yeah.
Thank you. Greetings to everyone and Chair Schumann. My name is Imam Sheikh Undao, and my religious group.
Sorry, I messed up the name. Go ahead.
You missed the name?
Go ahead.
All right. Yes. My name is Imam Sheikh Undao, and from the community from Melrose neighborhood in the Bronx.
Mm-hmm.
Okay. Today I'm speaking to in a strong support for Intro 641 initiative, a proposed bill that requires an improved nutritional standards for kids' meal at all restaurants in New York City. As you have heard from others today, the bill will address a lot of medical issues, health issues. The Bronx is the county with many of the worst health outcomes in New York State. In fact, the South Bronx neighborhoods we serve at Darussalam are among the worst, are the most at risk of health problems, with higher rates of obesity and hypertension and the lowest rate of self-reported good health in the entire city. Over there in the community, we struggle with high rates of poverty and other social insecurities. And that's more the reason why first and foremost, what we consume is more important to avoid junk food. So that's the main reason why we are supporting this legislation to pass through. I hear from people, children from the community are drawn to fast food and junk food campaigns, exposing them to a path of poorer health and reduced quality of life. But fortunately, in our Islamic faith, we have a teaching about what foods are permissible. It goes further to teach about foods that are called tayyib in Arabic, and that word means in English pure food, good food, clean and wholesome. So referencing, this part that is I just mentioned, that could be found in the Holy Quran, Surah 7, 160. And
can you wrap up your testimony, sir?
Okay, I'm going to round up now. Okay, for lack of time, so I'm just going to round it up. So this is the reason for our strong support for Council Member Riley's leadership and the advocacy for the Health Committee to see this bill through to passage. As we say in Wolof, Jerijev, thank you very much.
Thank you very much.
Yes.
Emily, right?
Hello, good afternoon. Thank you for the opportunity to testify. My name is Emily Giron. I live in Hell's Kitchen, and I'm a junior at Beacon High School. I am also an intern at Chili's on Wheels. I support the nutrition standards and beverage options for children's meals served in food service establishments, Intro 641, because not only have unhealthy meal options negatively impacted the health of my community and family, but it has also impacted my motivation to lead a healthy lifestyle. I come from a low-income family. We often have to resort to buying from fast food restaurants because they are more affordable. This lifestyle has impacted my younger siblings' health, leading them to have higher levels of sugar and cholesterol. I urge you to vote in favor of this bill because many low-income families struggle with this exact issue. Most importantly, a disproportionate number of young kids struggle with various issues such as diabetes and obesity. This number impacts Black and Latino communities the most. Furthermore, kids' meals in fast food restaurants contain unhealthy levels of sugar, sodium, and fats. This is why it is important to include kids' meals that meet the nutrition standards. As an intern of Chili's on Wheels, I have urged City Council members to co-sponsor our bill, hung posters around my neighborhood, and overall push the importance of children's health within my community. This bill would promote healthy lifestyles for young children, preventing them from life-threatening diseases in the long run. It would also benefit low-income communities by expanding. Thank you for your time.
Thank you. Next person, Tiffany, right? Okay.
Good afternoon. My name is Tiffany Lee, and I'm here today to encourage your support of Intro 641, which would improve nutrition standards for kids' meals at restaurants in New York City. I'm Executive Director of Altagracia Faith and Justice Works, a nonprofit organization in Northern Manhattan dedicated to putting faith into action and promoting social justice. We organize social justice ministry teams that address a variety of issues, including food justice. We also run a youth service learning program called Global Thinking, Local Action, Universal Impact, or GLUE. In this program, students serve in local soup kitchens, food pantries, and at the community fridge on 205th Street. They also hear from guest speakers and participate in workshops about disparities in food access, learning tools to organize and advocate for food justice. They learn about disparities in not only accessing any food, but accessing nutritious food that meets dietary standards, especially for developing children. While the highly palatable, less nutritious foods are very familiar to them, our students are often shocked to learn about the potential harm these foods and drinks can cause children, as well as adults long term. They're further shocked and outraged at the extent of these disparities and the correlation between the prevalence of fast food establishments in their neighborhood, foods that are often high in sodium, fat, and added sugars, and the greater incidence of diet-related diseases, i.e. obesity, diabetes, high blood pressure, and heart disease, etc., in these same Black and Latino neighborhoods. Teens and families in our city's fast-paced environment are often pressed for time, seeking quick, affordable, tasty options for their children and families, and it is difficult to find healthy options on the kids' menu. Our youth leaders have been very active and vocal on this topic and would have been here today if their class schedules allowed, but they will be submitting additional testimony in writing for your consideration. In partnership with the Interfaith Public Health Network and the Center for Science in the Public Interest, other community-based organizations, and inspired by the leadership of our youth, we urge you to pass Intro 641 to make a difference for children and families in New York City and to be an example for other cities around the country. Thank you.
Thank you. Rabbi?
Hi, good afternoon. My name is Rabbi Yonah Berman. People don't usually tell me to talk louder. Good afternoon. My name is Rabbi Yonah Berman. I'm the Dean of Rabbinic Initiatives at YCT Rabbinical School in the Bronx. The first words that Jews say in the morning are modeh ani, literally, thank you. Thank you, God, in that context. But it teaches us that gratitude is a central value in our Jewish tradition. Many of us just gathered around food this past weekend, thinking about perhaps a complicated history, but a reality that giving thanks of gratitude need always be on our minds. I come today to say thank you as a rabbi, as a resident of the Bronx. Thank you to Chair Schulman, to my local council member, Eric Dinowitz, and to the many supporters of Intro 641. I thank the Interfaith Public Health Network for its tireless work in bringing a diversity of people of faith, of health workers, clergy, and others around our shared passion for health and for the well-being of our cities, all of its residents, and especially its children. I hope and pray that Intro 641 and other similar bills serve as steps, perhaps baby steps, but important steps, in our shared and holy work in bettering the health of all New Yorkers. Thank you very much.
Thank you very much. I also want to mention that I am a co-sponsor of this legislation, so thank you all for your testimony. Okay, we're going to have, the next panel is Reverend Edward Chinnery, Kelly Moltzen, Sylvia Sabarin, Carolina Espinosa, and Dr. Sanjeevan Patel. Okay.
Hello, I'm Ed Chinnery, Associate Rector of Church of the Ascension here in Greenwich Village, where I also serve as Executive Director of Ascension Outreach, Incorporated, our in-house 501c3. The main focus of our outreach program at present is a client choice food pantry where we serve close to 1,000 individuals each month, the vast majority of whom self-identify as monolingual in Chinese. They are mostly senior citizens as well, and I share this because in the 12 years I've been with this organization, we have found ourselves learning a great deal about the importance of providing healthier food choices. In response to those that we serve, we have eliminated entirely canned vegetables, canned fruit, and canned protein, and since 2018 have been offering exclusively frozen protein, tofu, and only fresh produce. We receive, consequently, a fair amount of input from our end users regarding how they fare during and after medical procedures, not only having more comfort in recovery because of the food itself, but feeling more at ease overall. We also find there's a great deal of literature regarding better nutrition and positive health outcomes, and so we're convinced that if this is the case with senior citizens, then overall benefits must be very compelling as regards children and healthier food intake. New York City residents support policy efforts to increase the availability of healthier kids' meal options at restaurants, according to a new survey commissioned by the Center for Science in the Public Interest. These policies include nutrient standards for restaurant kids' meals, requirements for the inclusion of healthy foods in restaurant kids' meals, and requirements that restaurants serve healthy beverages with kids' meals by default. We believe that healthier children make healthier adults, and healthier adults require less medical care and far less uncompensated medical care. The CDC, NIH, and the Office of Disease Prevention and Health Promotion offer very powerful support for the rationale behind this legislation at hand today, and so I am happy to offer my own gratitude as well as that of the communities I represent regarding Intro 641 and all the related initiatives being advanced by Healthy New York, the Interfaith Public Health Network, and all its allies. Thank you very much for this opportunity.
Thank you. Next.
Thank you, Chair. Thank you, Chair Shulman and members of the Council Health Committee for the opportunity to testify here today. My name is Kelly Moltzen, and I am a registered dietitian and founding co-convener of the Interfaith Public Health Network, or IPHN. IPHN builds bridges between faith communities and public health experts to promote a holistic public health awareness, cultivate partnerships to transform public health, and advocate for systems and policies that support health and well-being for all. I helped to launch IPHN after years of striving to achieve health equity in the Bronx, and have coordinated efforts to increase access to and consumption of healthy foods in schools, bodegas, restaurants, and other community settings. Towards that end, IPHN has been proud to help coordinate the community advocacy response for Intro 641 with our colleagues at Center for Science in the Public Interest and the American Heart Association. The sad reality is that children born today are expected to have shorter lifetimes than their parents. This goes against the trajectory of human history, is unnatural, and flies against wisdom cultivated over millennia that enabled human beings to extend their lifetimes by accessing nutritious food. Diet-related diseases such as obesity are affecting our city's children, particularly youth of color, at alarming rates, with 20% of children in New York City having obesity and double that number having overweight or obesity, with higher rates in marginalized neighborhoods across the 5 boroughs. The nutrition standards which would be required by Intro 641 can begin to reverse this trend and work towards health equity by providing more fresh, healthy options for kids' meals in New York City restaurants. Moreover, implementation of the bill will be a critical part of the process of achieving this goal. IPHN is committed to working with our partners to support the Department of Health and Mental Hygiene in establishing an implementation plan that works for New York City restaurants. We appreciate your time and consideration of this important request to pass Intro 641 and increase nutrition options in kids' meals in New York City restaurants. Thank you.
Thank you, Dr. Patel. By the way, I used to, not on the medical side, I used to work at Woodhull. I'm very familiar with Wyckoff Hospital.
Committee. It is my pleasure to present here and also testify. My name is Dr. Sanjeevan Patel. I'm serving the New York City at Borough of Brooklyn for more than 4 decades in a capacity of a physician. At present, I'm a chairman of Department of Pediatrics at Wyckoff Heights Medical Center, Bushwick, Brooklyn. And also on behalf of American Academy of Pediatrics, I'm a president of Chapter 2 and a fellow of Obesity Section, American Academy of Pediatrics. I'm speaking today here to urge Council to support the Intro 641, requiring the improved nutrition standard for the restaurant kids' meals in the New York City. Well, as everybody's aware of it, and quite a few previous speakers has mentioned, but I would like to allude to you. At present, we are facing neonatal, I'm a neonatologist, neonatal obesity also. Newborn baby is born average 200 grams, means half a pound. Of unhealthy weight. And that leads to first 1,000 days, if we don't take care of these kids from the conception to the second birthday, we are CDC in childhood obesity has mentioned in up to 2017 to 2020, 12.7% 2 to 5 years of age obesity, 20.7% 6 years to 11 years, 22.2% 12 to 20 years of age. Altogether, I would say 1 out of 5 kids, and particularly resources-restricted neighborhood like Wyckoff Heights Medical Center, we have a very high challenge. And that's why we embark on a HEAL program. We call it Healthy Eating, Active Living. And that's...
You can sum up. You can take a couple.
So fresh vegetables and seasonal fruits, drink water instead of sugary drinks, find physical activity, which kids love it, and it's in the school, and also the teacher, parents, everybody has to participate. Enough sleep, 8 to 10 hours. Screen time should be limited, less than 2 hours. And self-care, stress, mental health challenges, breath work, meditation, mindfulness, journaling, yoga. It helps the benefits, like achieve the healthy weight, healthy teeth, because dental caries is a big problem, supports the muscles and bones, fractures are less, immunity boosting, gastrointestinal function will improve, better brain development, and a healthy growth of the kids. I support strongly.
Thank you. Next.
Good afternoon. My name is Sylvia Sarin, and I live in Ocean Park, Queens. I am a Bangladeshi community public health advocate and a consultant and volunteer with IPHN. From October 2022 to June 2024, I worked for the American Heart Association, where I served as the project coordinator on the National Hypertension Control Initiative project. It is those experiences which lead me today to offer my strong support of Intro 641, requiring better nutrition standards for restaurants' kids' meal in New York City. As you have heard today, hypertension or high blood pressure is a very serious concern and driver of premature mortality, including deaths from heart disease and stroke. Like type 2 diabetes, hypertension was once considered as an adult-onset problem. Sadly, it is now far too common among young people. In fact, the CDC has reported that 1 in 25 American youth aged 12 to 19 have hypertension, with 1 to 10 having elevated blood pressure. Youth with higher blood pressure levels in childhood are more likely to have persistent hypertension as an adult. Furthermore, the prevalence of high blood pressure is higher among Hispanic and non-Hispanic Black children compared with non-Hispanic white children, making this a health equity issue. To resolve these trends, we will need to do a much better job of preventing risk factors, especially child and youth overweight and obesity. This must include encouraging healthier restaurant offerings, not only to mitigate child and youth overweight and obesity, but to steer young people away from high sodium diets. Intro 641 can assist in that regard by giving families healthier choices when they dine out, including limits on total sodium. Thank you for your time and consideration.
Thank you. Next.
Thank you, Chair Schulman and members of the Council Committee on Health for the opportunity to testify here today. My name is Carolina Espinosa. For the past 9 years, I have been an employee of a local nonprofit called BronxWorks, where our mission is to help individuals and families improve their economic and social well-being. Currently, I am the program director for the SNAP-Ed Nutrition Education and Obesity Prevention Program, and I'm also a licensed registered dietitian. My work at BronxWorks is to lead a team of nutrition educators, many of whom are Bronx natives, to go out into the Bronx community and implement evidence-based nutrition interventions with different age groups from youth to older adults. We also work on food environment strategies, specifically healthy retail, to help make the healthy choice the easy choice for community members in the stores where they shop and eat. Our SNAP-Ed Nutrition Education Program provides after-school youth with nutrition education and physical activity programming daily throughout the school year. Part of this curricula is to learn about food marketing and food labeling to make so they can make healthy informed decisions. For the adult population, we cover a range of nutrition topics and conduct grocery store tours led by a nutritionist to show community members how to shop for healthy options and stay within budget. Through our work with SNAP-Ed and the Healthy Retail Program these past 9 years, we are aware of how prevalent unhealthy food marketing is in Bronx communities. Access to affordable, healthy food is in competition with food in stores and restaurants that are designed to be attractive and easy to eat. Policies that align with the work we do on SNAP-Ed and support healthy choices in food establishments, such as restaurants, will have a greater impact on improved health outcomes. As an expert in the field of nutritional sciences and community health, I urge you to support this important bill that will help increase the number of healthy options for kids in kids' meals in restaurants. Thank you for your time.
Thank you. So before the panel leaves, Caroline, does BronxWorks, do you work with the borough president's office on some of the stuff? Because I know they have a health person there that.
Yeah, we're in communications with them.
And you do work on diabetes, I assume, like that's part of.
We had an NDPP program, the National Diabetes Prevention Program, but now I think the Department of Health leads more of the diabetes education programs.
Okay, if there's any, because I want to make sure that that moves forward, so if you need any help with that, contact the council and we'll figure that out.
Yeah.
Dr. Patel, Healthy NYC should talk to you about what you brought up here, so I have your contact information. I'm going to ask them to contact you, okay?
More than welcome.
Okay.
Thank you.
Thank you very much. I want to thank the panel. Thank you. Next panel is Sarah Ribakov, Elaine Perlman, Rebecca Johnson, Kiara, I hope I'm pronouncing it right, Ring, and Benjamin Kenigsberg. Okay, great. You can proceed.
Thank you. Hello, my name is Sarah Ribakov, and I'm here with the Center for Science in the Public Interest. CSPI strongly supports Intro 641. CSPI has long worked to achieve our vision of a healthy population with a reduced impact and burden of preventable disease and an equitable food system that makes healthy, sustainable food accessible for all. A 2020 study found that 20.9% of children in New York City's K-8 public schools had obesity. Bill 641 will support the health of New York City's children by making sure healthy food options are available on kids' menus in restaurants. This policy has overwhelming support from New York City residents. A CSPI commissioned survey in April found that specifically 86% of caregivers of children ages 13 and younger support a policy requiring 2 kids' meals to meet nutrition standards. Kids' menu items at chain restaurants are frequently high in saturated fat and sodium compared to recommended limits. The 2020 Dietary Guidelines for Americans recommend that children reduce intake of added sugars, saturated fat, and sodium, as overconsumption of foods high in these nutrients can increase risk for diet-related disease. For example, it is important to offer unflavored, non-fat, or low-fat milk instead of flavored milk and 2% or whole milk because of the extra added sugar and saturated fat found in these options. Advocates have turned to public policy to make progress in this space. 3 counties in Maryland have passed legislation requiring restaurants with children's menus to serve a kid's meal that meets nutrition standards. We urge New York City to join this growing movement and continue its work to improve the nutrition and overall health of children. By passing this legislation, you can increase the availability of healthy foods at restaurants, encourage children to form healthy eating habits, and support caregivers' efforts to feed their children well. Thank you.
Thank you very much. Next. You have to, yeah.
Hello, my name is Elaine Perlman. I donated my kidney to a stranger, and I'm the executive director of Waitlist Zero, working hard to end the kidney shortage that kills 25 Americans every day by passing 2 federal bills, the End Kidney Deaths Act and the Honor Our Living Donors Act. I am also a proud mentor with Plant Powered Metro New York. We aim to prevent and reverse chronic diseases. Today, I'm speaking about the harms of ingesting 2 things that remain on your healthy food menu: fruit juice and yogurt. Many fruit juices and yogurts are sweetened with high fructose corn syrup. In the recent study of 50 different brands of foods containing high fructose corn syrup, 30% of all the foods contained measurable levels of the heavy metal mercury, a known neurotoxin and cardiac toxin, while 60% of the dairy products in the study contained mercury. In 1776, Americans ate 4 pounds of sugar a year. Now it's 160 pounds per year per person. Sugar is a leading cause of heart disease, the annual killer of 700,000 Americans. High dietary sugar intake leads to increased triglycerides. What are triglycerides? Picture a sticky, globby, fatty substance that blocks our arteries. This globby fat turns our arteries from flexible pipes with clean pink walls to arteries that are hardened, inflexible, and low functioning. So please skip the fruit juice and instead drink the cocktail that makes our bodies sing with happiness, that oxygen hydrogen cocktail, water. And how about yogurt? Some people mistakenly believe that cow's milk yogurt is a healthy food. Yes, yogurt has healthy probiotics. We can get probiotics from fermented foods or non-dairy yogurt. What is bad about dairy yogurt? It naturally contains 1 to 5% of trans fats. Other yogurt additives may include food coloring made from crushed bugs and butterfat, which is even more addictive than yogurt. What if fruit is added to yogurt? The milk proteins block the fruit's vitamins, minerals, and plant chemicals from getting into our cells. The absorption of the fruit's nutrients are actually blocked by dairy. Sweetened fruit juice and yogurt are killers that harm our cells. Please cut fruit juice and yogurt from the children's menus.
Thank you very much. Next.
Good afternoon. Thank you for this opportunity to testify on this bill today. My name is Rebecca Johnson. I'm a chef, nutrition educator, and partnerships manager at Plant Powered Metro New York. For over 10 years, I worked in New York City public schools as a chef and nutrition educator, giving me daily opportunities to talk with kids about food in cafeterias and classrooms. When kids learn about how the food and beverages marketed to them impact their health, they're often outraged. They've asked me, why aren't healthier options available instead of junk? And why aren't adults doing more about the problem? At Plant Powered Metro New York, we're addressing these concerns through our Plant Powered Plates program, which promotes healthier meals in restaurants, which supports bringing these options, making them available on their menus. And so while some chain restaurants are beginning to offer healthier options that are plant-based and fiber-rich and no sugary drinks, measures like this one set a critical precedent. Food service establishments must meet higher standards to protect the health and well-being of their customers, especially children. Recommending water and non-dairy sugar-free beverages as default options for kids' meals is a step in the right direction. Science supports this approach. When fruit is eaten whole, the natural sugars enter the bloodstream slowly, providing sustained energy. In contrast, straight fruit juice causes blood sugar spikes, contributing to health issues like childhood diabetes. And studies have suggested that fat accumulation from meat products aggravates insulin resistance. Yet, which in turn contributes to type 2 diabetes. Whole grains, legumes, vegetables, and fruits, which are fiber rich, actually are low fat and promote health. School menus have already evolved, allowing principals to remove flavored milk, while food service teams are increasing plant-based options. Restaurants, however, have not widely caught up. It's time to hold them accountable for supporting the health and well-being of New York City's children and families. I commend the Council for considering this amendment to children's meal standards. Cities like Louisville, Kentucky, with their Healthy Drinks in Kids' Meals Ordinance, have taken this bold step, and now it's New York City's turn to lead. Thank you for your time and leadership.
Thank you. Next.
Hello and good afternoon. Before I get started, on behalf of myself and my fellow colleagues, I'd like to thank the City Council for having us here. My name is Kiara King. I'm a senior attending the Moore High School for Law, Advocacy, and Community Justice on the MLK campus, and I'm an intern for Teens for Food Justice. In 2023, I became an intern for Teens for Food Justice, a nonprofit organization that aims to eliminate food insecurity and promote youth-led activities with a hydroponic farming system. We help to work on the Intro 641 bill, which intends to promote healthy eating habits and lifestyles in children. I'm here today to urge the Council to pass the Intro 641 bill. It is a known fact that consuming unhealthy and processed foods can pose significant health risks. I think about my grandmother who, despite faces diabetic limitations, still prioritizes the importance of healthy eating and maintaining good health. This bill requires restaurants to have 2 healthy kids meals that meet expert nutrition standards that put limits on such as salt and sugar. Excess salt and sugar are the leading causes of health risks and diseases. Meals that contain too much salt can contribute to water retention, stroke, kidney diseases, and an overall negative impact on cardiovascular health. Sugar also impacts raising blood pressure, cholesterol levels, increasing the risk of obesity, cardiovascular diseases, and diabetes. An excess amount of salt and sugar can be detrimental to our overall health and well-being. By passing this bill, we're taking a crucial step in combating harmful health practices and improving public health. Not only will this bill promote healthier eating habits, but it will also reduce the immense burden in our healthcare system. Thank you for your time.
Thank you very much. Next.
Hello, my name is Benjamin. I'm a native New Yorker and also have 12 years working in healthcare. I'm not a parent, but I appreciate children because they're awesome and they're our future, and also I feel we have a responsibility to nurture them and be good stewards for them. So I'm absolutely in favor of Bill 641. So we were talking about prevention earlier. So there's so much causative research that shows hypertension, obesity, diabetes, cancer, even obstructive sleep apnea is caused from meat, dairy, eggs, salt, and sugar in the food. So with this bill, we can basically we have a preventative effect with just getting, even if it's just 10% of these calories now that kids are going to get from whole plant foods, is going to be a significant difference for their health. Not only that, but the more plant foods we eat, the less animal foods we eat. So that means the less animals we have to exploit. All these animals are sentient. They're individuals just like cats and dogs, and it's egregious the way that we treat animals, not to mention things like zoonotic diseases and antibiotic resistance when we have all these animals crammed together in factory farm situations. So not only that, but we can close some of the gaps around health for different races. For example, Black and Asian Americans are 75 to 95% lactose intolerant compared to the white counterparts. So we have all these kids drinking dairy milk is causing a lot of problems just right there. So again, they call plant-based diets a Swiss Army knife solution we have for the planet when it comes to climate change, resource allocation, human health, animal health. So it's really just what they call a Swiss Army knife solution. So I'm super in favor of Bill 641. Grateful to be here. And there's some amazing documentaries online. So there's one called They're Trying to Kill Us. There's one called You Are What You Eat, that's on Netflix, the Stanford Twin Experiment, where they took 2 groups of twins, gave one a plant-based diet and the other a meat-based diet, and look at all the health outcomes. And then you can also look at What the Health online, so there's some great resources. Thank you.
Thank you, and I also want to mention that two things. One is hydroponic planting. I put a lot of funding into the schools in my district for that, and I know a lot of other council members do as well. And that's very important, and it teaches kids to grow their food and appreciate it and everything else. And a lot of the food that they actually grow, at least in my district, they give to food banks. So I'm really appreciative of that. And also I wanted to mention that I used to think yogurt was healthy too until I started looking at the label. And so I'm very careful about that now. So, but thank you all, everybody, for your testimony. Next panel is Tammy Switzer. Is it, sorry if I don't pronounce this, Nisa, I think it is? Am I pronouncing that correctly? Or close? Wilfredo Farrier, Paula Ventura, and Virginia Encarnacion. Sorry if I mispronounced. Folks here? Any of those I'll pronounce. I'll do one more time. Tammy Switzer. Oh, that's you. Okay, fine. Nisa Tavares. Wilfredo Farrier. Paula Ventura. And Virginia, I guess not. Okay. All right. So let me call from the other panel. Dr. Natalie Grievous-Peters. Okay. We're gonna call some other folks to come up on the panel since the others don't seem to be here. George Nierenberg. Okay. Hussein Yadabari. Sean Butler. Yes, no? Are you here? Is that him? Oh, okay, fine. How do you pronounce your first name? I'm sorry. Shinakwa, okay. All right. Tammy, go for it.
Good afternoon, Chair Shulman. My name is Tammy Switzer Hagler. I am a master's candidate at the CUNY School of Public Health. I am also a constituent of District 12 from Co-op City. I support Councilman Riley's and Co-Chair Schulman's intro 641. Statistics show that childhood obesity and diabetes are an epidemic in communities all across New York City. I'm sorry, excuse me. Across New York City. I believe this minor adjustment in the offering of beverages on the children's menus in restaurants would benefit children, yet not infringe on parental rights. The bill amended the beverage options in children's meals to include removing flavored milk as an option and reduced juice sizes were offered. Parents can still opt for the sugary drinks if they choose to. From a 2003-2004 study from the Columbia Center of Children's Environmental Health, 15 to 19.4% of children in New York City are overweight and 22 to 27% are obese. I ask that the City Council approve Intro 641. Thank you for your time.
Thank you. Next.
Good afternoon. My name is Dr. Natalie Graves-Peters, and I'm a researcher with the Laurie M. Tisch Center for Food Education and Policy. I'm also a registered dietitian nutritionist. I've worked in many of the communities that are represented here today. I have a PhD in behavioral nutrition and also a parent to a 7-year-old daughter who loves great food. Today, I'm here to express my strong support for INT 0641, which is a critical step towards ensuring healthier kids' meals in restaurants across our city. When dining out with my daughter, we avoid kids' menus, not because of cost, but because they are almost always the same predictable options. These meals are not only repetitive, but also lack the fruits, vegetables, and whole grains that children need. And as a result, we order from the regular menu only to face oversized portions that are inappropriate for children. This is not just my family's experience. Research shows that children consume nearly twice as many calories at restaurants compared to meals at home, with most kids' meals being high in calories, salt, and fat. Parents like me are left with limited unhealthy choices when dining out. By supporting INT 0641, the Council can make a great difference. This legislation would ensure that restaurants offer healthier kids' meal options that includes fruits, vegetables, and whole grains, providing families with choices that promote growth, health, and well-being. It's a necessary step to empower parents and shift the culture around eating out. As both a nutrition professional and a parent, I urge you to vote in favor of this bill to help make healthy eating the default for New York City's children. Thank you for your leadership and the opportunity.
Thank you. Next.
Members of the New York City Council, I am here to express my strong support for Bill number 1047, directing the city's health department to implement a screening pilot program for sleep apnea. I lost my marriage, my job, and almost killed my grandchildren and daughter while driving. If I had been diagnosed and successfully treated for sleep apnea, this would not have happened to me. I just discovered that I could apply my career experience as a successful documentary filmmaker to make others understand the suffering of untreated sleep apnea and the opportunity that diagnosis offered to my well-being, my family, my career, and my contribution to society. My latest film, Out of Breath, shares potent, impactful scenes of the real-world impact of sleep apnea from 4 diverse individuals and their families, the same people that the New York City Council represents, white and black, young and old, married and single, straight and gay. I heard from dozens of parents, spouses, friends who had no idea that the exhaustion, the living in a fog, the constant fatigue, the irritability, the lack of focus, and even the frightening near misses behind the wheel were all symptoms of something that could be treated. These are real stories of people who felt like they were failing in life, but the truth was that they were fighting a battle that no one could see. This is a program so important. It's not just a piece of legislation, it's a lifeline. It's a chance to change the course of lives of the people of New York City. Thank you.
Thank you, sir. Next.
Good afternoon, Chair Shulman and esteemed members of the Health Committee with us virtually. My name is Hussein Yadaberry. I am the Executive Director of Muslim Community Network. I was born in Harlem, I was raised in the Bronx, and like so many of us, I grew up eating from restaurants' kids' menus that offered the same sugary drinks and salty processed foods that are still in front of children today. Back then, we were still learning about the impacts of these meals on long-term health, but in 2024, we know exactly how these excessive sugars and sodium contribute to chronic illnesses like diabetes and heart disease, especially for low-income Black and brown New Yorkers. As a person of faith, I approach this issue with a deep commitment to values of care and moderation that are central to Islam. We are taught to avoid excess and to prioritize what sustains us, not just in the moment, but over the long term. Intro 641 reflects that same value of moderation by ensuring that at least 2 children's meals on every menu meet the basic nutrition standards. Removing flavored milk and reducing juice portions, these aren't extreme measures, they're common sense steps to protect our children's futures. For families like mine growing up in the Bronx, these healthier options weren't available, and we're now seeing the consequences play out in our communities. The chronic illnesses so many face are not just personal struggles, they're systemic issues that reflect years of inequity in the food options marketed to us. Intro 641 is about changing the narrative and making sure the next generation has the sustenance to thrive. This legislation doesn't take choices away. I think, like the mom said to my right, it makes healthy choices easier. It gives parents the ability to make decisions that align with their values of care and responsibility, while holding restaurants accountable for offering balanced options. Chair Shulman, I urge you, members of the committee and the entirety of the council, to support Intro 641 and help us to ensure that every child in New York City, regardless of their zip code, has access to a healthier future. I would also like to shout out IPHN and CSPI for bringing us on to this initiative. Thank you.
Thank you. Next.
1, 2 is okay. All right. All right, here we go. Imagine a community where every child has access to healthy food, where no one has to choose between a meal and their health. In the Bronx, this vision is not yet a reality. Thank you, Chair Schuman and members and staff of the Council Committee on Health. My name is Shanak Rashawn Butler, and I am a resident of the University Heights section of the Bronx in Council District 14. Today, I'm here wearing 2 hats. First, as a longtime community health advocate, I've dedicated myself to increasing access to healthy food and educating young people around nutrition. My journey began with a deeply personal experience, my mother's battle with cancer. My mother, Joycelyn Butler, was a nurse who dedicated her life to caring for others. Unfortunately, she passed away from cancer at age 57. Witnessing her struggle and the lack of healthy food options in my community was heartbreaking. This personal experience led to me taking action and creating the Fresh Healthy Food Initiative, which aims to provide fresh, healthy, grab-and-go, plant-based meals in Bronx bodegas. My aim is to make the Bronx a healthier place, one bodega at a time. Through grassroots community engagement, I have worked with community stakeholders, local bodegas, to increase access to healthy, nutritious grab-and-go options at a price point that can compete against the ocean of cheap, ultra-processed foods that dominate Bronx bodegas. The Fresh Initiative has already made meaningful difference in the lives of many Bronx residents by successfully demonstrating the feasibility and demand for healthy meal options in local bodegas. This growing demand for healthier options shows the community's readiness for change and sets the stage for an even greater impact as we expand our efforts. Looking ahead, I plan to partner with the Bodega and Small Business Group, Collective Fair, Bronx Health Reach, NYU Stern, and the New York Health Foundation to bring healthy grab-and-go options to the Hunts Point, to bodegas and Hunts Points in 2025. Second, I serve as the lead organizer of community health initiatives for Banana Kelly's Community Improvement Association, tackling the social determinants of health around. In this role, I oversee the health initiatives. I'm gonna just jump to the end because I don't have enough time. But in conclusion, in this role with Fresh and also working at Banana Kelly, I have witnessed firsthand the positive impact that dedicated community health efforts can be. By supporting policies like Intro 641, we can take significant steps towards ensuring that all children have access to healthy food options, thereby fostering a healthy future for our community. I urge you to each to support Intro 641 today. Let's ensure that every child in our community has a healthy start that they deserve. As the rapper from the hip-hop supergroup The Lox once said, Styles P once said, "You can't really get wealthy if you ain't healthy." This quote highlights the critical connection between health and overall well-being, making it a powerful reminder of why our work is important. I urge you guys to support Intro 641. Thank you for your time.
Thank you very much. Thank you to this panel. Really appreciate your testimony. And whatever you didn't get to, just make sure that we have it. We have submit the testimony. Eloisa Trinidad, are you here? You're here. Wait, 1 second. You good? Okay. Yeah. Okay, go ahead.
Good afternoon, esteemed members of the council. My name is Eloisa Trinidad, and I am the executive director at Chili's on Wheels. I stand before you today to passionately advocate for Intro 641, which establishes vital nutrition standards and beverage options for children's meals served in food service establishments throughout New York City. Chili's on Wheels works to make healthy, plant-based food accessible to communities in need, and we do this through direct food relief, policy, education, and mentorship. We serve communities in the 5 boroughs and work on policy at the city, state, and federal levels to transform our food system to a more just, equitable, and sustainable one for all beings. All our services are free to our community members, and we take a comprehensive approach to food education and food sovereignty that focuses on justice from farm to fork and in addressing the historical wrongs our communities face due to the impacts of Western colonization and systemic policies that further marginalize them. From our beginnings, we have included and centered children and youth voices in our advocacy. Our students learn about the food system itself and how to advocate for themselves and their communities at every point of it. Earlier, you heard from Emily Giron. Students just like Emily have been a critical part of our policy wins at every level, including our most recent wins in the USA National School Lunch Program. Our children and youth are taking action, and we must further support their efforts through bills like Intro 641. But what is often not seen or heard are the heartbreaking stories directly from children who lack access to consistent, healthy food, the desperation and sadness that I see and hear at every food distribution and mentorship workshop, the children are dealing with anxiety and depression because they experience a chronic illness and fear their younger siblings will face the same. Our children and youth must be protected, and we must create the foundation for them to succeed. As a liberation and food activist for over 20 years, I continue to be deeply concerned about the impact of nutrition on children's growth and development, and implementing concrete nutrition standards is essential for ensuring that our children receive meals that not only satisfy their hunger, but also provide the key nutrients necessary for their physical and cognitive advancement. Our children represent the future, and it's our responsibility to prioritize their health. The reality of childhood chronic diseases and associated health challenges is alarming. By enforcing these robust nutrition standards, we can effectively combat these issues and foster healthier eating habits and create a more sustainable future for all of our children. This bill is in perfect alignment with Chili's on Wheels' commitment to health equity and a more sustainable future, ensuring that all of our children, regardless of background or circumstances, have access to wholesome, healthy foods. I want to thank you for your actions on sugary drinks, in particular emphasize the need for better and healthier drinks in all these restaurants. By curbing sugary drink consumption and providing healthier options such as water and plant-based milk, we can influence children to make better choices. The transformation that we will have a lasting impact on children's eating habits, leading to a healthier future for them and their communities. Thank you for taking action and for your attention and consideration in protecting our children.
Thank you very much. Let's see. Next person, Sharon Brown Jeter. I just want to remind everybody that there's more testimony. Please keep it to 2 minutes. If you have extended testimony, you could submit it to the council. Thank you.
Hello, my name is Sharon Brown Jeter. Remember, Israel, release the hostages, let Yahweh's people go. Defend Israel. Okay, I ate everything, candy, cake, cookies, all meats, fruit juices, all kinds of juices and foods. I was 98th or higher percentile in my schools and testing. My mother was a nurse, my father was military and a chef. He was also a boxer, so they knew a whole lot about food and fitness. Biblically, fat is good for the body and the brain. We know that through avocados and things like that. We can't deplete fat, sugars, and things like that. If you don't allow children to eat foods and let their body process sugar, then later on in life, you're going to say their body can't handle sugar, and you're going to say they're diabetic because their body is not comfortable with using sugar. This has never been a problem in all our history, that people had such a major problem with eating foods and being diabetic and things like that. The Bible is going to be implemented in the schools. It started already in Oklahoma, and we cannot force people to eat any way we choose. We just have to provide food, and we have to provide enough of the food. The only thing banned in the Bible are foods sacrificed to idols like Allah, Buddha, and things like that. The Jewish dietary restriction is their choice based on the Bible. We just have to provide enough for them. So when I look at the Jewish portions they have in the food, I would say give them 2 of those. If they eat only 1, that's fine. If they eat both or as many as they need. Some children are athletic. They could eat like a bear. That's not our business. Give them what they need. If children say they want something, they may have allergies that they can recognize that we don't know about. Let children eat. Do not starve our children.
Thank you very much.
You're
Appreciate
welcome.
it. Okay, now we're gonna, hold on, let's see. Yeah, we will now move to Zoom testimony. I will call groups of 3 names at a time. Please wait for your name to be called to testify, and please select unmute when prompted. G.U. Lee, Raul Rivera, Liana Levine Reisner. Okay, so G.U. Lee,
Hello?
are you online?
Hello? Hi. Oh, can you hear me?
Yes, go ahead.
Oh, okay. Yes. Good af- oh, sorry. Good afternoon. My name is Ji-Yu, and I am a master's student at CUNY School of Public Health. I'm here to testify in support of Bill Introduction Number 0641, which is an essential step toward addressing the growing public health crisis of childhood obesity and promoting healthier eating habits for our children. Unhealthy restaurant meals are a significant threat to children's health. According to the National Institute of Health, about 19% of children in the United States are obese, and 15 to 19.4% of NYC children are overweight, and additional 22 to 27% of children are obese. This trend has been linked to the rise in fast food and restaurant meals that are high in calories, sugars, and saturated fats. Research shows that meals at restaurants frequently exceed the daily recommended calorie intake, with children averaging more than 1,000 calories per meal when eating out, much of which comes from unhealthy ingredients. Bill Introduction Number 641 is a crucial response to this, requiring at least 2 meals on every children's menu to meet certain nutrition standards will make sure that healthier options are available for children when they dine out. These meals would be designed to limit saturated fats, sodium, and added sugars, which are significant contributors to childhood obesity and related health problems. The bill also addresses the issue of flavored milk and large juice portions, both major sources of added sugars. The American Academy of Pediatrics recommends limiting sugary drinks for children, and large servings of juice can contain excessive sugar up to 30 grams per serving, far exceeding the recommended daily intake for kids. Furthermore, it is important to recognize that food insecurity disproportionately affects certain communities. According to a 2022 report released by the Mayor's Office of Food Policy, Bronx residents experience the highest rates of food insecurity, which is 19.7% of all five boroughs. This highlights the need for better access to
Your time
nutritious
has expired.
foods, especially for vulnerable populations. The food we give
Just,
our
you have
children
to,
today shapes their health for the future. Yes.
you have to sum up now, because the time is
yes.
up.
The food we give our children today shapes their health for the future. I urge you to support Bill number 0641 to create a healthier food environment for our children. Thank you.
Thank you, and you can also submit your testimony to testimony@council.nyc.gov, the part that you didn't get to talk about, okay?
All right, thank you.
You're welcome. Liana Levine Reisner, are you online?
Yes, I'm here. Thank you so much, Councilmember Schulman.
Sure.
So my name is Liana Levine Reisner. I'm a co-founder and the network director of Plant Powered Metro New York. We're a nonprofit organization whose mission is to make sure every New Yorker knows that whole food, plant-based nutrition can prevent, treat, and even reverse many chronic diseases, including high blood pressure, diabetes, and cardiovascular disease. We have proudly signed up to be a Healthy NYC champion because we offer programming that has already proven its value in reducing New Yorkers' blood pressure, cholesterol, triglycerides, weight, and many other markers of health, including measures of depression and anxiety. The Healthy NYC plan is laudable in naming quantifiable goals to increase life expectancy. I'd like to point out that reducing deaths from infectious diseases, pregnancy-associated deaths, and the prevalence of mental health conditions and chronic diseases, including asthma and many screenable cancers, must involve a significant change in how we view and mold our food system. The truth is that we can't make substantial changes to these issues with incremental food system adjustments. We need to go all in. So as you provide oversight to the health department, please make it clear that food-based solutions must be ambitious and far-reaching, that we must confront the elephant in the room, that the norm of eating animal-based and processed foods is creating these epidemics. Regarding Intro 641, the intent of the bill is good, and I also urge you to consider these ways to improve upon the nutrition standards articulated in the bill. Earlier this fall, the U.S. Dietary Guidelines Advisory Committee made a draft of its recommendations for the 2025-2030 guidelines, which for the first time encourages a shift to nutrient-dense plant-based meals, an idea that could be incorporated into this bill as a way of providing positive guidance. The committee also advises that grains served are mostly whole grains rather than at least 50% whole grains. A third recommendation is to change the order of protein subgroups to first recommend beans, peas, and lentils because plant proteins are associated with health, whereas we continue to be advised to reduce our intake of red and processed meat, like the hamburgers and hot dogs found on kids' menus.
Your time has expired. Thank you.
If you can just sum up, go ahead. You can give us some.
The nutrition standards in the bill don't differentiate meat from meat alternatives, nor do they recommend plant proteins. So as the federal committee is poised to do, I believe we can do more to set higher standards locally for vulnerable children who are at the whims of our food system. Thanks so much.
You can submit the rest of your testimony to testimony at council.nyc.gov, and I'm very happy that you're part of the Healthy NYC. Thank you very much. Raul Rivera.
Good afternoon. Can you hear me?
Yes.
Good afternoon, Shulman, Chair Shulman. I want to talk about insulin resistance and type 2 diabetes. Actually, type 2 diabetes is when you do it to yourself with a Western diet. So we want to urge the Committee on Health to draft bills that are going to ban food preservatives from our food supply. To name a few of these preservatives and chemicals, asuflame potassium, aspartame, sucralose, MSG. And for the parents who like to take their children out to eat ice cream, they should consider and look up a chemical called carrageenan. Carrageenan is a pro-inflammatory chemical that's used in laboratories to induce cancer in lab animals. So we urge the council to draft bills to remove these preservatives from our food supply, ensuring our health and our future. I think that's very important. Also, when it comes to aspartame, artificial sweetener, that chemical was made possible not by doctors, not by healthcare professionals, but by elected officials. We encourage the council to look at a documentary called Sweet Misery. Again, the documentary is called Sweet Misery. The ADA, the American Heart Association, supports aspartame, and aspartame is a known carcinogen. Thank you so much.
Thank you very, very much. I'm going to call some names to see if you're present. Ethan Suarez, Manpreet Kaur, Elise Cole Grant, Lucia Atkins Jones, and Elizabeth Kane. Okay. Thank you to everyone who has testified. If there's anyone present in the room or on Zoom that hasn't had the opportunity to testify, please raise your hand. Seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted for the record up to 72 hours after the close of this hearing. Wait. Elise Cole Grant?
Hi, can you hear me?
Yes.
Hello, good afternoon, everyone. I just wanted to provide my testimony that I am in support of this bill. I am a mother of two who lives in New York City, and wanted to include that, research has shown that when eating at restaurants, children consume more calories, sugar, and sodium. We all live in New York for the diversity of the people that we live next to, our neighbors, and that also includes our food choices, right? And I choose to live in New York City, and particularly Brooklyn, to expose my children to different cultures, and that includes food flavors, textures. So I am very much in support of this bill because I believe that my children have the right to choose, right? And usually what I see on children menus are chicken nuggets, buttered pasta. Those are both things that are very easy and cheap to prepare at home. When I actually decide to take my children out, I'd like to have them have a more broad choice of healthy food options so they can experience not only healthy food, but also the culture that we want to expose our children to, right? And sure, it's easy to say, well, why don't you choose to purchase another entree for them instead of just choosing off the children's menu? Well, that leads to my next argument is that that's very costly for the parents, right? When we already have so many bills to cover for our children, it's costly to have to choose outside of the children's menu, knowing that our child will only eat a portion of the food that we purchase if it is a regular adult entree. Particularly, my children like seafood. They don't like breaded things. And so that leaves me with very limited options to choose at restaurants that I think that our children, will thank us for later if we can expose them to more healthy food options and make it, affordable for the parents.
Thank you very much. Really appreciate your testimony.
Thank you.
Okay, so one more time, thank you to everyone who has testified. If there's anyone present in the room or on Zoom hasn't had the opportunity to testify, please raise your hand. Okay. Seeing no one else, I'd like to note that written testimony, which will be reviewed in full by committee staff, may be submitted for the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. I also want to mention that Healthy NYC has only been in effect for a year, and they've had some positive results, and I am committed as the chair of the Health Committee to making sure Healthy NYC keeps advancing and moving forward and meets the goals of a healthier New York City. Thank you very much to everyone who has testified for the legislation as well as Healthy NYC. And with that, I'm closing out today's hearing. Thank you.